Stikes Indonesia Maju merupakan jantungnya sekolah tinggi kesehatan di Indonesia. Berdiri pada tahun 2000, kampus yang beralamatkan di Jalan Harapan nomor 50, Lenteng Agung, Jakarta Selatan, didirikan atas dasar rasa cinta tanah air dan ingin berkontribusi dalam mencerdaskan kehidupan bangsa melalui bidang pendidikan. Stikes Indonesia Maju berkomitmen dalam mencetak lulusan yang siap bersaing dan menjadi tenaga kesehatan yang profesional di bidang kesehatan. Sesuai dengan visinya, Stikes Indonesia Maju menjadi institusi yang berdaya saing nasional dalam pengembangan ilmu pengetahuan dan teknologi di bidang kesehatan melalui pengembangan masyarakat untuk meningkatkan derajat kesehatan. Stikes Indonesia Maju saat ini sudah terakreditasi oleh Bank PT dengan predikat B dan memiliki 13 program studi, diantaranya S2 Kesehatan Masyarakat, S1 Kesehatan Masyarakat, S1 Ilmu Keperawatan, Program Profesi Nurse, Sarjana Terapan Kebidanan, Pendidikan Profesi Bidan, S1 Administrasi Rumah Sakit, S1 Gizi, S1 Farmasi, Sarjana Terapan Keselamatan dan Kesehatan Kerja, Sarjana Terapan Manajemen Informasi Kesehatan, Diploma 3 Administrasi Rumah Sakit, dan Diploma 3 Asuransi Kesehatan. 7 di antara program studi sudah terakreditasi B.
Assalamualaikum warahmatullahi wabarakatuh. Selamat datang di STIKIM, Sekolah Tinggi Ilmu Kesehatan Indonesia Maju. Saya, Asri Tovita, sebagai Ketua Sekolah Tinggi Ilmu Kesehatan Indonesia Maju, ingin memperkenalkan STIKIM sebagai kampus pendidikan kesehatan yang telah berdiri sejak tahun 2000. Sampai saat ini, STIKIM telah meluluskan sebanyak 9.345 lulusan. STIKIM telah memiliki 13 program studi, yaitu Magister Kesehatan Masyarakat, Sarjana Kesehatan Masyarakat, Sarjana Keperawatan, Profesi Nurse, Kebidanan Program Sarjana Terapan, Pendidikan Profesi Bidan Program Profesi, Sarjana Gizi, Sarjana Administrasi Rumah Sakit, Sarjana Farmasi, Sarjana Terapan Manajemen Informasi Kesehatan, Sarjana Terapan K3, Diploma 3 Asuransi Kesehatan, dan Diploma 3 Administrasi Rumah Sakit. STIKIM telah terakreditasi dengan predikat sangat baik. STIKIM memiliki visi pada tahun 2038 STIKIM menjadi institusi yang berdaya saing nasional dalam pengembangan ilmu pengetahuan dan teknologi di bidang kesehatan melalui pengembangan masyarakat untuk meningkatkan derajat kesehatan. STIKIM sedang berproses menjadi Universitas Indonesia Maju dengan konsep Health Tech berbasis komunitas. Besar harapan kami, STIKIM dapat terus berkembang menjadi kampus pendidikan kesehatan terdepan sesuai dengan moto kami, The Heart of Health School. Semoga STIKIM selalu memberikan manfaat dan dapat mencetak generasi untuk memajukan kesehatan Indonesia. STIKIM untuk Indonesia Maju. Assalamualaikum warahmatullahi wabarakatuh.
Dalam proses belajar mengajar di Stikes Indonesia Maju, selain tatap muka, terdiri dari praktik laboratorium, praktik klinik, dan tutorial. Didukung dengan tenaga pengajar yang profesional di bidang keahliannya masing-masing, serta sudah berkualifikasi akademik S2 maupun S3. Tidak hanya itu, Stikes Indonesia Maju memberikan beasiswa kepada mahasiswa berprestasi dan kurang mampu. Stikes Indonesia Maju memiliki fasilitas untuk menunjang proses belajar mengajar seperti internet hotspot, perpustakaan yang lengkap dan update, laboratorium terintegrasi, laboratorium bahasa, laboratorium komputer, laboratorium audio visual, radio komunitas untuk menunjang promosi kesehatan oleh mahasiswa, serta sistem informasi akademik mahasiswa yang berbasis teknologi informasi. Stikes Indonesia Maju juga telah memiliki rumah sakit sendiri, yaitu Rumah Sakit Dr. Hafiz di Cianjur, Jawa Barat, sebagai sarana untuk menunjang mahasiswa dalam melaksanakan praktik di lapangan.
Well, ladies and gentlemen, may I have your attention, please? Our webinar is about to begin. Thank you very much for preparing yourself to join our webinar. International Webinar 2022, Faculty of Public Health, University of Indonesia Maju. With them, towards after COVID-19 endemic readiness for a global students and workers. Saturday, 5th February 2022. Assalamualaikum warahmatullahi wabarakatuh. Good morning and good luck to all of us. Respectable, the Foundation President, University of Indonesia Maju, Dr. Andes Yakub Khatib. Honorable Governing Board, University of Indonesia Maju, Profesor Dr. Hafizur Rahman, MPH, SH. Honorable Deputy Chancellor, University of Indonesia Maju, Dr. Astrid Novita, SKM, MKM. Honorable Vice Chancellor for Academic, University of Indonesia Maju, Mr. Susaldi, SST, MKAS. Honorable Vice Chancellor for Non-Academic Fields, University of Indonesia Maju, Dr. Rindu, SKM, MKAS. Honorable Professor Dr. Elmeli Kurnia Wijaya, MSc SPOK, Doctoral Department of Epidemiology, FKM, UI. Honorable Professor Dr. Krishna Gopal Rampal, Professor at University of Cyberjaya, Malaysia. Honorable Dr. Harimat Hendarwan MKAS, researcher at the National Institute of Health Research and Development Lecturer of University Indonesia Maju. Honorable Fitri Kurniasari, SKM MKK, doctoral student in the Department of Occupational and Environmental Health, Faculty of Medicine, University of Nagoya. Respectable all participants of this webinar. Firstly, let thanks to the Almighty Allah Subhanahu wa Ta'ala, who has given us some mercies and blessings so that we can attend this webinar without any trouble and obstacles. Secondly, may peace be upon the Prophet Muhammad Sallallahu Alaihi Wasallam, who has guided us from the darkness to the brightness era. Ladies and gentlemen, I am Ratna Widyastuti, a student of the Faculty of Public Health, will be the master of ceremony. And let me read out our agenda this morning. The first, opening. The second, technical guidelines and procedure national health webinar. The third, singing the national anthem of Indonesia Raya. The fourth, playback video about University of Indonesia Maju. The fifth, Vice Chairman Committee report. The sixth, welcoming speech from Deputy Chancellor. The seventh, presentation of material that will be guided by the moderator. The eighth, discussion and question and answer and summary. The ninth, closing speech. The 10th, gift distribution. The 11th, closing. Next, I will read technical guidelines and procedure national health webinar. The application that will be used for this webinar is Zoom Cloud Meeting. The second, the webinar starts at 8:20. The third, participant must use an identity with the following format: full name, _origin of institution or agency. Use the full name that will appear on the certificate. The fourth, participant who activate the camera use polite clothes and backgrounds that have been provided by the committee. The fifth, participant must turn off the microphone or mute feature during the webinar activity. The sixth, participant will be given the opportunity to ask the research person guide by the moderator by using the Zoom chat column or the raise hand feature. The seventh, participant must fill in attendance. The link will be sent via WhatsApp group and the Zoom chat column and can be accessed at 11:30 until 11:40. The eighth, webinar material will be given at the end of the event by committee with a Google Drive link via WhatsApp group and the Zoom webinar chat column. Step on the following agenda is singing the national anthem of Indonesia Raya. Next, playback video about Stikom UIMA, which has now turned into Advanced University of Indonesia Maju.
Stikes Indonesia Maju merupakan jantungnya sekolah tinggi kesehatan di Indonesia. Berdiri pada tahun 2000, kampus yang beralamatkan di Jalan Harapan nomor 50, Lenteng Agung, Jakarta Selatan, didirikan atas dasar rasa cinta tanah air dan ingin berkontribusi dalam mencerdaskan kehidupan bangsa melalui bidang pendidikan. Stikes Indonesia Maju berkomitmen dalam mencetak lulusan yang siap bersaing dan menjadi tenaga kesehatan yang profesional di bidang kesehatan. Sesuai dengan visinya, Stikes Indonesia Maju menjadi institusi yang berdaya saing nasional dalam pengembangan ilmu pengetahuan dan teknologi di bidang kesehatan melalui pengembangan masyarakat untuk meningkatkan derajat kesehatan. Stikes Indonesia Maju saat ini sudah terakreditasi oleh Bank PT dengan predikat B dan memiliki 13 program studi diantaranya S2 Kesehatan Masyarakat, S1 Kesehatan Masyarakat, S1 Ilmu Keperawatan, Program Profesi Nurse, Sarjana Terapan Kebidanan, Pendidikan Profesi Bidan, S1 Administrasi Rumah Sakit, S1 Gizi, S1 Farmasi, Sarjana Terapan Keselamatan dan Kesehatan Kerja, Sarjana Terapan Manajemen Informasi Kesehatan, Diploma 3 Administrasi Rumah Sakit, dan Diploma 3 Asuransi Kesehatan. 7 di antara program studi sudah terakreditasi B.
Assalamualaikum warahmatullahi wabarakatuh. Selamat datang di STIKIM, Sekolah Tinggi Ilmu Kesehatan Indonesia Maju. Saya, Asri Taufita, sebagai Ketua Sekolah Tinggi Ilmu Kesehatan Indonesia Maju, ingin memperkenalkan STIKIM sebagai kampus pendidikan kesehatan yang telah berdiri sejak tahun 2000. Sampai saat ini, STIKIM telah meluluskan sebanyak 9.345 lulusan. STIKIM telah memiliki 13 program studi, yaitu Magister Kesehatan Masyarakat, Sarjana Kesehatan Masyarakat, Sarjana Keperawatan, Profesi Nurse, Kebidanan Program Sarjana Terapan, Pendidikan Profesi Bidan Program Profesi, Sarjana Gizi, Sarjana Administrasi Rumah Sakit, Sarjana Farmasi, Sarjana Terapan Manajemen Informasi Kesehatan, Sarjana Terapan K3, Diploma 3 Asuransi Kesehatan, dan Diploma 3 Administrasi Rumah Sakit. STIKIM telah terakreditasi dengan predikat sangat baik. STIKIM memiliki visi pada tahun 2038 STIKIM menjadi institusi yang berdaya saing nasional dalam pengembangan ilmu pengetahuan dan teknologi di bidang kesehatan melalui pengembangan masyarakat untuk meningkatkan derajat kesehatan. STIKIM sedang berproses menjadi Universitas Indonesia Maju dengan konsep Health Tech berbasis komunitas. Besar harapan kami, STIKIM dapat terus berkembang menjadi kampus pendidikan kesehatan terdepan sesuai dengan moto kami, The Heart of Health School. Semoga STIKIM selalu memberikan manfaat dan dapat mencetak generasi untuk memajukan kesehatan Indonesia. STIKIM untuk Indonesia Maju. Assalamualaikum warahmatullahi wabarakatuh.
Dalam proses belajar mengajar di Stikes Indonesia Maju, selain tatap muka, terdiri dari praktik laboratorium, praktik klinik, dan tutorial. Didukung dengan tenaga pengajar yang profesional di bidang keahliannya masing-masing, serta sudah berkualifikasi akademik S2 maupun S3. Tidak hanya itu, Stikes Indonesia Maju memberikan beasiswa kepada mahasiswa berprestasi dan kurang mampu. Stikes Indonesia Maju memiliki fasilitas untuk menunjang proses belajar mengajar seperti internet hotspot, perpustakaan yang lengkap dan update, laboratorium terintegrasi, laboratorium bahasa, laboratorium komputer, laboratorium audio visual, radio komunitas untuk menunjang promosi kesehatan oleh mahasiswa, serta sistem informasi akademik mahasiswa yang berbasis teknologi informasi. Stikes Indonesia Maju juga telah memiliki rumah sakit sendiri, yaitu Rumah Sakit Dr. Hafiz di Cianjur, Jawa Barat, sebagai sarana untuk menunjang mahasiswa dalam melaksanakan praktik di lapangan.
Okay, next agenda is the report from Mr. Sulfikar as the Vice Chairman of Committee. Mr. Sulfikar, time is yours.
Okay, thank you, Mrs. Ratna. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. My name is Sulfikar, as the Vice Chairman of this webinar today. And thank you to the committee for giving me the opportunity to give a report as the Vice Chairman of the webinar. The Honorable Dr. Astrid as the Chancellor Universitas Indonesia Maju, along with the staff who attend this webinar. Dear Sir or Madam, the speaker we have invited to this webinar, dear participant who attend this webinar, I would like to thank you for your availability to attend the Towards After COVID-19 Endemic Readiness for a Global Student and Workers webinar. The main objective of this webinar is to educate the public in general and public health practitioners in particular in improving preparedness and adapting to the existing pandemic conditions. Where we are, we got to be able to survive and return to our normal life, such as going back to school and working. This webinar was attended by approximately 350 participants with various expertise and educational backgrounds. The participants come from Indonesia, Malaysia, and Japan. Hopefully, this webinar can provide new knowledge and add insight to all participants in improving preparedness for the pandemic. And also, I wanna say to thank you and respectful to all of you fellow students of the public health study program who become the committee in this event. Thank you for your hard work in last couple months to make it this event was carried off well. In closing, I congratulate the team for Indonesia Maju of University and all. Thank you. Enjoy this webinar. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you to Mr. Surfikap for the report. Ladies and gentlemen, it is now an honor for me to invite Director, University of Indonesia Maju, to give us welcoming speech and officially open our webinar. For Ms. Dr. Astrid Novita, SKM MKM. The stage is yours.
Thank you, Ratna. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera untuk kita semua. Good morning, ladies and gentlemen. The Honorable Keynote Speaker, Professor Dr. Elmeli Kurnia Wijaya MSc, SPOK from University of Indonesia, Professor Dr. Krishna Goparampal from University of Cyberjaya Malaysia, our dear Dr. Harimat Hendarwan, MKes, from National Institute of Health Research and Development, who is also our beloved lecturer in UIMA. And Ibu Fitri Kurniasari, SKM MK3, candidate of doctoral from Nagoya University, Japan. Our beloved chairman and founder of Yayasan Indonesia Maju, Bapak Dr. Andes Jakub Hatip, and Professor Dr. Hafizur Rahman, MPH, SH. And most importantly, the Honorable Organizing Committee of International Webinar of UIMA, Department of Public Health, and all participants. Distinguished guests, ladies and gentlemen. Sorry. A very good morning to you all. First of all, I would like to welcome to the University of Indonesia Maju to our first international webinar, whereby the topic is Toward After COVID-19 Endemic Readiness for Global Student and Worker, arranged by Department of Public Health. It is with my pleasure that we proudly present you this international webinar since our inauguration as university on 25 January 2022 and as a result of merging of our STIKIM, Indonesia Maju Health and Science University College, and STIKOM, STIKOM IMA, Indonesia Maju Communication University College. We believe by merging these two university college, STIKIM and STIKOM IMA, to become a university, UIMA will expand the development of our scientific scope, not only limited to the health sector, but also expanding toward other scientific scope such as social and academic studies locally as well as internationally. Of course, we not undermine the fact that currently there are 4,400 universities in Indonesia, and it won't be easy for us being a new player as a university to position ourselves. UIMA as an advanced and progressive university in science and technology for your future. Although it will take time, effort, and fun, as well as new strategy to position our university as the university for your future leading, presenter, and growth. Today's webinar is also part of our tangible effort and activities in our international collaboration in education as manifestation of Tridharma Perguruan Tinggi between University of Cyberjaya Malaysia and University of Indonesia Maju Indonesia. We all know that our world is presently very much affected by the novel coronavirus disease or COVID-19, and the WHO mentioned that we still facing the third transmission of the latest version of COVID-19, namely variant Omicron. Indonesia, being a fourth most populous country in the world, is predicted to be significantly affected for a long time by this pandemic. Hence, this webinar is being held for us to study and anticipate action that can be done to handle the new normal and recover the effect of COVID-19 socially, economically for the life of public and can move toward endemic. WHO also mentioned that it may take a decade for the world to recover and may have to significantly compromise with the progress of the Agenda of Sustainable Development Goals in 2030. Once again, before closing my speech, and on behalf of University of Indonesia Maju, I would like to express our sincere gratitude and appreciation to our honorable speaker, Prof. Meli from Universitas Indonesia, Prof. Rampal from Universitas of Cyberjaya Malaysia, Dr. Harimat, Dear Lecturer in UIMA, and our candidate Dr. Mbak Fitri Kurniasari, who is currently studying in Nagoya, Japan. Your presentation and participation in our first international webinar is very much appreciated. I would like also give applause to Department of Public Health, the chairman and members of the organizing committee for this webinar for their enthusiasm and dedicated that this webinar can be held today. Hopefully, this webinar will provide anticipation of understanding, readiness, and ability for the community to implementing a healthy culture to control and prevent COVID-19 in the community at large, locally, and globally. Therefore, with the grace of Allah Subhanahu wa Ta'ala, hereby I officially open UIMA International Public Health Webinar by saying Bismillahirrahmanirrahim. May Allah Subhanahu wa Ta'ala bless us with His blessing for the success of this webinar. Thank you. Wabillahi taufiq wal hidayah. Assalamualaikum warahmatullahi wabarakatuh. Thank you, Ratna.
Thank you to Ms. Dr. Astrid Novita, SKM, MKM. As we have finished our opening, to lead the next session, I would like to introduce Ms. Rima Ida, and Mr. Siswa Anton Saputra as moderator for the webinar today, and also assist by the interpreter, Ms. Nabila Edlinisa and Mr. Barik Hammam Rabani. Okay, before that, we will play back a video to for University Indonesia Maju.
Dan yayasan akan terus membantu sekolah Ladies and gentlemen, because speaker one, Prof. Millie, has not joined the Zoom room, please wait for a while. Thank you for your attention.
Apologize for the inconveniences. Okay, once again, apologize for the inconveniences. As we have finished our opening, to lead the next sessions, I would like to introduce Ms. Rima Ida and Mr. Siswa Anton Saputra as moderator the webinar today, and also assist by the interpreter Ms. Nabila Adlinisa and Mr. Barik Hammam Rabani. All right, I will read her curriculum vitae first. Ms. Rima Ida was born in Medan, April 5th, 1989. Last education, Poltekkes Kementerian Kesehatan Jakarta 1, Department of Midwife, currently continuing her education at University of Indonesia Maju. Motto, failure is normal, but the real failure is when we stop trying. Second, Mr. Siswa Anton Saputra was born in Bandung, November 29, 1985. Last education, Diploma Paramedic Science, New South Wales, Australia. Currently, his education at University of Indonesia Maju. And then we invite them to guide the presentation of material from our speakers. It's good to make time effective. Just go directly to Ms. Rima Ida and Mr. Siswa Anton Saputra. The stage is yours.
Thank you for our Master of Ceremony for the opportunity. It is a wonderful and precious chance for me. Good morning, ladies and gentlemen. My name is Rima Ida, who will guide the presentation of Session 1. Ladies and gentlemen, the COVID-19 pandemic has changed a lot of things since it hit the world. This pandemic destroyed various existing social structures. We all forced to adapt to a high degree of uncertainty. The question is how to form a healthy and safe culture, especially for a global students and workers during the pandemic until the end of this pandemic. It will be discussed by our speakers in this session. First, I will introduce our speakers in this first session. I would like to welcome to our speakers who has been with us at our event today. The very first one is Professor Dr. Elmeli Kurnia Wijaya, MSc, SPOK. Professor Meli has many background of study. As you can see at the monitor, the latest education of hers is Doctoral of Epidemiology. Professor Meli has many job experience. One of them is the head of K3 Laboratory at FKM UI. Now, the current job of Professor Meli is permanent professor of the University of Indonesia in the field of K3. Professor Meli also has intellectual property rights holder of the several of books, which you can see on the screen. Those are information about our first speaker. Now, we will directly listen to the presentation from our first speaker. Please welcome Professor Dr. Elmeli Kurnia Wijaya, MSc, SPOK.
Okay, thank you so
Professor
much.
Meli,
Yeah, good morning,
time is
everybody.
yours.
Yeah.
Good morning, Professor
Can you
Meli.
hear me? Can you hear me?
Yes, I can hear you, Miss Professor Meli. Yeah.
Yeah. Maybe for the best effect, I will use my headset. Yeah. Thank you so much for inviting me to join this very spectacular meeting held by our S1 ya, S1 K3 ya.
Yeah, Prof.
To public health ya.
S1 Public Health, yes.
Okay, yeah, thank you so much I feel happy and I feel blessed to be with you here. To stickers Indonesia Maju, all of the leaders, all of the pimpinan, congratulations for your student in this very proudly meeting. Okay. Without any further ado, let me share my screen. Okay.
Yeah, Prof.
Yeah. Okay. Can you see my?
Yeah, we can see that. Yeah, Prof.
Okay, thank you. I'm so sorry. Cannot move. It seems hang, yeah. Cannot move it. Okay. Yeah. Very slow movement, yeah. Slow movement. Okay. Oh, can you help me for share my screen?
Yeah, we can assist you, Prof, to share screen.
I think this is not smooth, yeah.
Okay. Admin, our IT will help to share screen your presentation, Prof.
Okay, thank you. I have only 20 minutes, right?
Yeah.
Okay, thank you. Hopefully I can fulfill it.
Yeah, it's starting now, Prof.
Yang pertama ya.
Okay, yeah.
Okay, yeah. My topic is membentuk budaya sehat dan selamat di tempat kerja pasca pandemik. Okay. What happened next with COVID-19? Still full of uncertainty. I show you here. Yeah, about, is it keep mutating? What next after Omicron? Will it be ended? Or it should go to endemic? And when? And still full of uncertainty. Are you ready to work from home or work from office for students and for workers? Because, however, COVID-19 is still relatively new and is a new emerging disease. Okay. Our theme today is Toward After COVID-19 Endemic, Readiness for a Global Students and Workers. Saya coba-coba nih menerjemahkan kesiapan mahasiswa dan pekerja global menuju endemik COVID-19. But I try to regarding to this webinar, I would like to say hi everyone. Hi guys. The key points are, this is what was suggested by the team Lintas Disiplin Edukasi COVID-19, University of Indonesia COVID Education Cross-Disciplinary Team. We are from Faculty of Public Health, Faculty of Medicine, Faculty of FISIP, ya, ilmu politik, ilmu budaya. I happen to be one of the team members. Then we give you an advice, yeah, getting to know COVID-19, strengthening behavior, controlling pandemic. Jadi kuncinya adalah mengenali COVID. Sekarang ini banyak yang tidak bisa, ya. Jadi mantapkan perilaku, mengendalikan. That is our suggestion. That is our motto. Hi, you guys. Get your role to be an agent of change. Students and workers, take care of yourself, stay healthy, and don't get impacted. Take care of your community, don't impact others, especially the vulnerable. Who is vulnerable? Aging population, yeah, the aging population, people with comorbid, yeah, like diabetic, hypertension. Be a role model, active in educating and maintaining community health, the community surrounding. As a student and workers, we should take care of your community as an agent of change. Who are your community at the workplace? Your co-workers, yeah. This is not on say some, yeah. Your co-workers, your supervisors, your maybe the supplier. You may meet them. For the student, not only your classmate, maybe your docent, yeah, your teacher, attending in library, cleaning service, canteen handler, at as an agent of changes, yeah. Place you can count on your co-workers, cleaning service, yeah, supplier, guest, supervision managers, and you can be an agent. Also, people you meet in toilet, dining room, meeting room, praying room, on public transport, at home, neighbor and your neighborhood. Please always remember that at your home you have your parents, yeah, maybe like me, the sudah lansia, yeah, aging people, at the mall, sport, leisure, gym, and in campus. These are your community. These are your responsibility as a human being. You should take care of them. Okay, and how to? Of course, with strategic management. Workplace COVID-19 management policy. I mean, this is at the workplace. At least, yeah, the ventilation in the close the room. UV, maybe we can use HEPA filter, sanitation, quarantine isolation facilities, and work from home. How many you can make a policy. And don't forget upskilling your ability to prevent transmission. Obey the standard of operating procedure, improve your health, your immunity, and have a healthy lifestyle. Also, increasing awareness and ability of the community around you to prevent COVID-19. Okay, at least 3M, apa itu? Pakai masker, memakai masker, use mask, jaga jarak, tangan. You can play a role in increasing awareness and ability to prevent disease in the community. Amanah. Here are a few examples what our team did. I'm sorry, let me talk in bahasa. Sinergi interdisiplin, interdisiplin, beragam ilmu, public health, medicine, antropologi, sociology, ilmu budaya dan literasi, komunikasi and media IT, psikologi, pedagogi, dan kajian religious matters. This is kerjasama, coordination between UI and universitas di wilayah terkait with experts Indonesia. Kolaborasi transdiscipline with practice in civil society, media, government institution, and swasta, private sector. This is public. Pandemic leads to cultural shock. Pandemic condition adaptation menuntut terjadinya perubahan amat segera dari pengetahuan cara berpikir dalam berkomunikasi bersama. Padahal budaya memiliki dua karakteristik, tidak mudah berubah, dapat dikonstruksi di tantangannya bagaimana masyarakat Indonesia termasuk our workers bisa mewujudkan perubahan segera, can change their behavior dalam pengetahuan dan perilaku yang their cognitive, their knowledge, and their behavior. This is our gegar budaya, cultural shock. Kedisiplinan kerja di sekolah tidak boleh bolos, misalnya. Tidak boleh masuk. Semua nilai-nilai dalam waktu sekejap berbalik. This is the opposite of our belief. You cannot withdraw from your school. Now you cannot go to your school. Our belief that yang penting berkumpul, We need gathering, social gathering. Now we need help. Sopan santun, yeah. Now it's been become dangerous activity. We should avoid this. Ibadah bersama, we go to church, we go to mosque together. Now we pray by ourselves individual. Also jaga jarak sulit, populasi padat, dan we have the collective culture. Budaya mudik, went to hometown, go to hometown, cannot be very very dangerous. This is our happen cultural shock. It produce anger, bingungan atau kebingungan, penolakan, rasa kekosongan, kehilangan, kesedihan, stressful, depression, and psychosomatic. This is the cultural shock after the pandemic. Perilaku kesehatan dalam pandemi COVID, masyarakat tidak taat protokol pencegahan COVID. Ini terkait dengan pengetahuan, sikap, perilaku. Kalau pengetahuan mereka tidak paham betul, because they don't know what is the virus is, because it is we should visualize about the virus, because they feel that this is nothing happened because they cannot see, not visual, so we should visualize. Dia tidak mau, dia menolak, tidak peduli, dia abai, perilakunya tidak berubah. Nah, ini yang terjadi. What happened? They still use their old-fashioned belief, old behavior. Ya. Kebiasaan silaturahmi, berkumpul, itu masih saja pergi rame-rame. Dia marah, sedih, bingung, depresi, ya, perasaannya. They feel depressed, they feel sadness, they anger, and they overwhelmed. Ini mempengaruhi nilai kepercayaannya, stigma pada sebelum selesai. Kembali ke slide sebelumnya. Back to previous slide, please. Back to previous slide, please. Okay. Nah, this is the education literation method, ya, online and offline. Metode belajar, we use andragogi belajar orang dewasa. Caranya dialogis dan interaktif, partisipatif. Kita menggali pengetahuan mereka yang ada. Nah, ini yang penting. Kita kasat matakan yang tidak kasat mata melalui visualization video, kami sudah menyiapkan buku panduan metode belajar dari video. Ini juga untuk upskilling your knowledge, your capability to prevent disease as a student or as a worker. So you should take care of your surrounding. Di situ kita mendiskusikan ide baru yang dicermati bersama. What is do's and what is don'ts? Ya? What are do's? Specify and list the do's and don'ts list. And then we have a consensus, menyepakati bersama the new norm, norma budaya baru, aturan berperilaku, and the sanction. This should be from bottom up. Pastor maybe in classroom, in laboratorium, between CS atau custom cleaning surface, one by one, intensively influence them, not just external larangan. You cannot do that. You should pakai masker. You should pakai masker, cuci tangan, wash your hand, dan jaga jarak. Why? And then how our team believe that this is we should do separately clustering, and then the result is significant. This is the significant program. The significant program. We have 4 significant program to introduce you. Program pertama memberi edukasi literasi first, education and literation, and culture to the public in our community. And the second step is mengubah pertentangan budaya. We change the conflict of culture into ketahanan budaya, our cultural defense, between among our community. And the third step is dilakukan berdasarkan pengalaman kesehatan masyarakat dan kedokteran, kesehatan masyarakat, public health and medicine, and program edukasi berkelanjutan dari dimensi kultural. Jadi we match the medical and we match the public health and culture knowledge, and produce memaksimalkan program edukasi yang sudah ada. This is a significant program, not only for you, but once again, as you are as a public health student, you should do this. And you be workers, you should do it among your co-workers. Ini adalah konten panduan edukasi COVID, aspek medis dan kesehatan masyarakat. This is the content of our education, medical aspect and public health aspect. Oke, panduan yang unik, dia belajar mantap, perilaku nanti saya bisa kasihkan. Tujuannya memperkaya pengetahuan, not only knowledge, meningkatkan kesadaran dan mengubah perilaku, tidak cukup hanya dengan rekomendasi, himbauan dan instruksi. Memutus penularan virus di berbagai masker. Rasionalisasinya, visualisasi video mall, konten edukasi dasar-dasar unsur. Later on I'll show you what is the visualization yang perlu diintegrasikan dalam cluster tertentu, specific cluster. Tunjukkan, visualize the virus, hal-hal yang keliru, what is wrong, and yang menyebabkan penularan yang cepat, misalnya di kantoran, makan bersama, dalam mobil bersama tanpa masker, hal-hal yang benar untuk perilaku. Oke. Ini adalah 9 content of basic education. We have virus characteristic, taxonomy of virus, how the virus develop, the development of virus, the habitat, to the host, in the host, dalam inang, cara penyebaran dan pemulasaran, how they separate, what is the health impact, non-health impact, dari ekonomi, sosial, and pariwisata, tourism, cara mematikan, how to disinfect action and the mechanism, cara pencegahan penularan, how to prevent the contamination with 5M, 3T, vaksinasi and contact tracing. Pemeriksaan virus, waktu pemeriksaan antibodi, antigen, PCR, this is the test. This is our, because we know that this is the natural of cases that it can be imported cases, especially who works in Kalimantan, di pedalaman ya, in remote area, maybe vice versa, monthly, go back home and then you go back to the workplace. This is you can get infected and you can infect others. Yeah? And cluster cases, then local transmission here, the local transmission and cluster cases like diamond prints, cruise at the end of the 2020. This is around our cluster education, what we did ya, kelompok pekerja, the workers in office, mining, oil and gas, manufacture and construction, tourism, access, mobility, emitters, attraction, sports, and so on. Also in campus, religious matter, and perjalanan, transportation. Dan pencegahan penularan like this, 3M. And then this is you can show people and you should know that the separation with mask and with no mask, the distance may be more than 2 meters. The droplet is around 2 meters only, but the aerosol may be more, 6 to 8 meters. Ini, this is the locus minor locus COVID-19 separated. Misalnya makan bareng, dining together, in the leave, Wi-Fi photo group, when you are queuing, family gathering, in the meeting, especially for workers, you work with your co-workers at the closed room with air condition. This is now, we believe this is the most important one to separate it, to separate the COVID-19. Pesta pernikahan, wedding, asrama for students, toilet umum, when you are receiving paket dalam satu kendaraan in the same. Transportation in car, when technician come to your house or come to your kos-kosan, tempat pekerja or for workers also. Okay. This is the gejala, the symptoms. The symptoms, I think you all ought to know. Then the derajat beratnya COVID-19 nowadays, maybe Omicron is not so severe like before, the Delta, but it is still very dangerous for the children of adults. This is fever, cough, myalgia. This is the symptoms, and then recovery. This is the 24 days. I think you all already know this information is everywhere.
Prof, sorry for interruption. You have 5 minutes left, so we can continue to discussion session.
Oke. Nah, kalau ada yang akan memusnahkan manusia, dikatakan bukan perang, bukan kelaparan, tapi virus. Ya. Jadi ini ada film Outbreak in 1991, 1995. Ya. virus can more severe to destroy to human being, not the battle and not the lapar. Ini 3M, 2M plus 5M, memakai masker, cuci tangan dengan sabun selama 3 menit. Setelah itu baru basuh air. Jadi bukan di bawah air mengalir. You should wash your hand first with the detergent or with the soap because it can destroy the corona, which of lemak ya, terdiri dari lemak. Then you wash your hand with running water. Jaga jarak 2 meter dengan sekeliling kanan kiri depan belakang atau sejauh Anda merentangkan tangan. Menjauhkan kerumunan, mengurangi mobilitas, and stay at home. Still, if you have not no, okay. 3M plus vaccination, kita lawan corona bersama saudara sebangsa. Oke, thank you. Saya kira saya sampai di sini saja. Yang ini saya rasa any question. Selesai saya kira.
Yeah, thank you, Professor, for the presentation.
Moderator Rima Ida. Hai.
Yeah, thank you, Prof, for the presentation. That's very interesting. Yeah, we learned about the pandemic demands that we change our behavior ya tadi ya. Jadi pandemi ini menuntut kita untuk merubah perilaku kita ya. Oke, and
I'm happy to hear in bahasa Indonesia. I think Profesor satu-satunya itu from Malaysia. You can also follow us because our goal is to our participants can discuss more freely. Silahkan dalam bahasa Indonesia.
Okay, thank you, Professor Meli. Now we will continue to the discussion session. In the session, we will be assisted by Mr. Barik Rabani. For Mr. Barik, please start the discussion session.
Okay, thank you for the moderator. Okay, thank you very much, Prof. Meli, for such an interesting presentation. Maybe there are many audience who want to ask, but we will postpone it for a while after I explain for the question and answer session system. Okay, for this session, it will be limited to a maximum of 2 questions. For participants who want to ask question, please press the raise hand button on the menu in the Zoom meeting, and the selected participants have the right to ask questions. Or the participants can turn on the camera and ask the question briefly, concisely, and clearly. Okay, maybe there are many audience who want to ask. Prof, I will invite the audience to ask the questions. For the audience, please write on the chat menu or raise the hand button.
Bahasa Indonesia nggak apa-apa. Silahkan.
Oke, baik.
Bebas,
Kepada audiens kalian, boleh mengajukan pertanyaan. Boleh raise your hand, angkat tangan kalian di Zoom, atau boleh langsung ketik di kotak chat yang telah disediakan.
Feel free. Barangkali di
Feel
sini
free to
ada
ask.
any workers here?
Bisa nanti ada kan?
Izin bertanya, boleh, Pak Barik?
Oke, silakan.
Baik. Selamat pagi, Prof. Dari Sulfikar izin bertanya.
Ya, Sul, ya silakan.
Ya, gini Rob, jadi tadi pemaparannya luar biasa sekali. Dan kita tahu bahwa Omikron saat ini sedang menciptakan rekor ya dok ya. Kita tahu bahwa di Jakarta hari demi hari itu selalu rekor yang ada Prof, sangat tinggi grafiknya, dan kami juga yang tinggal di Kalimantan itu bisa dikatakan masih sedikit Prof. Jadi penularan virus Omikron ini memang benar-benar dari orang-orang yang habis dinas ke Jakarta itu datang ke Kalimantan, datang ke tempat kami, gitu. Nah, bagaimana cara kita meyakinkan kepada pekerja kembali, Prof, sebagai praktisi K3, cara kita membentuk habitnya lagi, karena kita tahu bahwa kita pelan-pelan sudah melepas masker, sudah kembali berkerumun meskipun belum ada instruksi untuk boleh berkerumun seperti itu. Tapi habit yang kita mengikuti protokol kesehatan itu sudah mulai longgar seperti itu, Prof. Nah, sedangkan Omikron ini kita tahu di Jakarta sudah mulai banyak sekali, dan siklusnya pasti seperti itu ya. Jakarta dulu, habis itu pelan-pelan akan datang ke Kalimantan untuk grafiknya bisa naik lagi, Prof. Nah, cara kita mungkin untuk sebagai praktisi K3 meyakinkan pekerja ini gimana, Prof, ya, supaya kembali membentuk budaya mereka untuk mematuhi protokol kesehatan. Mungkin seperti itu, Prof, dari saya. Terima kasih.
Okay, yeah, thank you so much, Pak Sulfikar. Yeah, a very practical question. Yeah, as a workers in Kalimantan, yes, you tell the truth bahwa segera akan menyebar, dan sekarang tajam sekali kita lihat spike-nya begitu tajam sekali. Jadi mau nggak mau kita, yang paling kita takutkan adalah kalau terjadi outbreak-nya luar biasa, our health facilities, jadi fasilitas kesehatan kita unbearable. This is overburden. Ya, itu yang paling kita takutkan. And then yang betul-betul perlu intensive care unit bisa terabaikan. Ya, itu yang paling kita takut. Jadi memang karyawan harus kita tingkatkan lagi. Jadi kalau dengan cerita tadi saya, yang paling penting tuh orang mau merubah perilaku, harus unsur perilaku personal. Jadi personalnya, jadi perilaku yang dari personal, keyakinan dirinya. Kalau kita mungkin pakai health belief model, dia tahu persis, baru dia bisa takut. Ya, seperti orang yang pernah kena COVID, yang pernah sesek, dia akan takut. Ya, yang pernah orang tuanya meninggal, dia akan takut. Ya, seperti saya, 2 keluarga yang dekat sekali dan 2 profesor, my friends, itu pass away because of COVID, ya. Itu saya sangat, saya bilang, katakan untuk orang-orang yang vulnerable, they are like playing the Russian roulette, to be and not to be. Jadi bisa mati atau tidak. Jadi yang paling penting adalah pengetahuan dulu, pengetahuan, and then dari pengetahuan itu, jadi nanti mereka itu setelah di masing-masing klaster kita diskusi, banyak yang mereka tahu, apa yang mereka belum tahu ditanyakan. Setelah mereka menanyakan, langsung kita tanyakan apa-apa yang kira-kira mereka nggak tahu. Maksudnya sekarang saya tanya, Omikron, ini pertanyaan tadi sekalian saya menjawab Ismail Soleh ya, bahwa ada nggak what the new drug of choice for Omikron misalnya. Kita bisa menanyakan, kalian yakin nggak bahwa ada nggak obat untuk virus? Kalau dia bilang, oh ada obat baru, nah, kita mesti kasih tahu bahwa virus itu sampai sekarang tidak bisa dimatikan. Like hepatitis, like HIV, itu tidak ada obat. Jadi jangan mengharapkan Anda ada obat akan keluar muncul. Kalau ada obat itu nggak bisa. Karena prinsipnya yang membunuh virus itu hanya antibodi yang dibentuk oleh kita. Nah, bagaimana? Dari vaksinasi atau dari terinfeksi. Ya. Nah, karena dari antibodi tidak ada obat, tidak ada drug of choice, Anda harus yakinkan itu. Dan Anda kasih tahu yang kedua, yang bahayanya itu, Anda tidak apa-apa bahwa Anda bisa menjaga OTG ya, orang yang sehat, jadi dia cuma sebagai carrier, tapi dia bisa membawa virus itu kepada your beloved one. maybe your parents, maybe your anak-anak, ya kan? Nah itu akan bisa kehilangan. Saya ada contoh keponakan bapak, my cousin, my husband cousins, ya kan? Itu anaknya yang kerja lagi bikin film Luna Maya waktu itu. Dia sakit, panas. Bapaknya cuma tahu, oh kamu panas ya? Nah, cuma kasih dia air minum, dikasih obat. And then besok paginya dari keduanya, itu dua-duanya sakit. Dua-duanya masuk ke rumah sakit, di rumah sakit Papa Gading di sini. And unfortunately, his father, 1 month later, because he's seniors, yeah, also, of course, he's a senior, and he's a senior, and he got diabetic and hypertension. 1 month after hospitalization, he passed away. Nah, kasus-kasus seperti you should show them, you should talk to them. Dan bagaimana Anda merasakan itu? Jadi Anda harus bertanya. Jadi mereka banyak yang nggak tahu. Ini saya sekalian menjawab yang ditanyakan oleh Ismail Soleh ya. Tidak ada obat untuk membunuh virus. Yang ada adalah meningkatkan daya tahan karena yang membunuh virus adalah antibodi. Nah, di dalam tubuh kita itu ada 14 hari dia bisa berkembang biak, ya kan? Kalau Omicron katanya itu dia spread-nya cepat, tapi karena dia kalau kita melihat mutasinya itu bisa di specification, bisa specify, diperiksa PCR, kalau diperiksa sequencing-nya itu dia tidak punya S-nya, paku S-nya itu dia nggak ada, itu Omicron. Tapi karena tidak ada pakunya itu, dia tidak masuk ke dalam paru-paru. Nah, kalau dia masuk ke dalam paru-paru di antara alveol dan blood vessel, di situ dia terjadi peradangan. Jadi peradangan dia kan menjadi besar. Jadi oksigennya untuk menembus dinding alveol ke pembuluh darah menjadi terhambat. Nah, di situ dia menjadi sesak. Kalau Omicron tidak. Omicron itu dia di tenggorokan atas. Jadi lehernya sakit. Ininya sakit. Jadinya dia kurang berbahaya untuk orang yang sehat, ya. Tapi untuk orang yang vulnerable, not necessary. Jadi yang kematian itu adalah orang yang punya komorbid, ya, dan orang yang tidak divaksinasi. Itu. Jadi untuk melakukan mereka supaya mereka mau nggak mau, kita pakai teori perubahan perilaku, kita aplikasikan the health belief model, ya, the green theory, ya kan, teori green, ya kan, reciprocity model, and trans theoretical model. Kalau ini saya ngomong, Sulfiar mungkin pernah dengar saya ngomong waktu di itu ya. Tapi kalau mahasiswa saya itu adalah di buku saya juga ada, saya selalu mengatakan you cannot change the behavior of your client, ya, your workers gitu ya. Despite they know exactly what can be happen and what can be attracted. Begitu Pak Zul. Jadi tetap Sulsar, kita harus memberitahukan apa bahayanya, bukan hanya kasih buku, kasih handbook, kasih apa namanya, kasih poster, kasih meme, enggak. Kita ajak mereka discussion. Nah, mengharapkan mereka dengan training of trainer, cara training of trainer, mereka dilatih dan terakhirnya mereka bikin role play, bagaimana mereka satunya ngeyel, satunya mengatakan, satunya ngeyel, pokoknya saya nggak mau pakai masker. Nah, bagaimana kita menggunakan. Setelah itu satu orang mengajarkan lagi 20-30 orang dengan cara snowball effect gitu ya. Hopefully kita bisa segera separate itu. That is what we are doing now. Our lintas disiplin ilmu itu Pak, barangkali bisa dipakai di perusahaan. Nah, untuk pertama kalinya kalau misalnya mau bekerja sama dengan kami, silahkan nanti saya bisa kasih nomor teleponnya, itu 20-30 orang. Kita memang tujuannya adalah mencerdaskan bangsa gitu ya. Kita tidak barangkali cuma sekedar buat yang memberikan sultan aja, kita nggak puluhan juta gitu, kita cuma yang kalau saya tahu perusahaan itu pasti mampu. Misalnya kalau yang sampai nggak mampu pun saya sering memberikannya tidak pakai bayaran, dibayar alhamdulillah, nggak dibayar pun alhamdulillah, itu prinsip kami. Mungkin ini juga bisa kita bekerja sama dengan Stikes ya, Stikes. Oke, saya kembalikan ke Pak Moderator. Back to you, Rima.
Okay, I apologize. We have to suffice for only
Mr.
2
Barik.
questions. Okay, ladies and gentlemen, that's the presentation from Professor Dr. Elmeli Kurnawijaja, MSc SPOK, with the title Forming a Healthy and a Safe Culture in the Post-Pandemic Workplace. Okay, before we end this presentation, I will try to conclude the result of this seminar presentation. So, based on the question, Omicron currently creating a record day by day. It is very high. The way we form the habit again, we know we are slowly already removing the masks, but yeah, it really significant. What we are most afraid of when an extraordinary outbreak occurs for people who are vulnerable, it's very scary. That the important thing is first, we discuss a lot of knowledge, what we know. Okay, for the second question, is there any cure for the virus, especially for the Omicron? No, that the virus can be killed until now. There is no medicine, nothing, so it's only antibody from us. There is no drug of choice. Secondly, you can also be a carrier even if you are healthy or not. Okay, the last thing is what Prof. Mary said, what will destroy humans is not hunger, but the virus will destroy us. Ladies and gentlemen, once again, we would like to thank the presenters and also the attendees who have participated in the seminar. Finally, I, as the interpreter, will give it back to the moderator. Thank you.
Thank you so much.
Yeah, thank you, Mr. Barik, for assisting our discussion session. And as our appreciation for the speakers, for Professor Meli, we will give you a certificate, Prof, for being a parent in this webinar.
Yes. Thank you.
This is yours. Yeah. Thank you, Professor Meli.
Thank you.
I think your presentation is very useful for us. And see you next time, Professor Meli.
Thank you. Izin leave. Thank you so much. Salam.
Yeah, Prof. Yeah, Prof. Yeah, Prof. Oh, Prof, I'm sorry. Before we continue, I would like to invite you to take a picture with us.
Oh, yeah.
Yeah, okay.
With pleasure.
Yeah, Miss Valentina will lead us to take a picture. Miss Valentina, you ready?
Ready? Okay, ladies and gentlemen, we will take documentation. Please turn on your camera. Ready?
Kak, bantu.
1, 2, 3.
Without glasses.
Second page. 1, 2, 3. Okay, finish. Thank you.
Okay, thank you, Miss Valentina. Thank you, Prof. Meli.
Terima
kasih, Prof. Meli.
Mohon maaf
Bye.
kekurangannya. Kirim salam yang amat terhormat untuk pimpinan, untuk Ibu.
Terima kasih, Prof.
Okay, ladies and gentlemen, the next second material will be given by the second speaker. I'm sure our second material is just as interesting as the first one. And I will introduce you to our second speaker who has been with us right now, Professor Dr. Krishna Gopal Rampal. I will introduce you to Professor Dr. Krishna. Yeah, you can see on the screen. Professor Dr. Krishna Gopal Rampal is Professor of Community and Occupational Medicine at the Faculty of Medicine, University of Cyberjaya. He joined UOC, previously known as CUCMS, in February 2017, after working 6 years at the Perdana University Graduate School of Medicine and 28 years at the Department of Community Health, Facultas of Medicine, University Kebangsaan Malaysia. Professor Rampal has the following academic qualification, as you can see on your screen. In October 2012, he was inducted as a fellow of the Collegium Ramazzini based in Italy. He received the first Lifetime Achievement Award from the Academy of Occupational Environment Malaysia in 2019. He has edited books in his field, written chapters in books, written scientific reports and policy documents, and published articles in both local and international journals. He is regularly invited to present papers at local and regional scientific conferences. Dr. Rampal has been involved in numerous research projects and consultancies. That was the profile of Professor Rampal. Ladies and gentlemen, let's invite Professor Rampal to present the presentation. Professor
Thank you.
Rampal? Yeah, the
Thank
time
you,
is yours,
Rima.
Prof.
Yeah, thank you, Rima. Can you hear me clearly?
Yeah, I can hear you.
Very good. Okay, I would like to thank, firstly, I'd like to thank the Universitas Indonesia Maju. I've always known it as STIKIM from the last 5 years. I've known about STIKIM and Dr. Hafiz and Dr. Rizki and a number of individuals from STIKIM. I'd like to thank you for inviting me, especially Nina, who's the head of the Department of Public Health, and also Siswa Anton Saputra, who's the chief executive. I received a letter of invitation for this webinar on the trends after COVID-19 endemic readiness for our global students and workers. Okay, I'd like to thank all of you for inviting me to present. Can you please share the slide, my slide presentation, please?
Okay, sir. We will help you.
Yes. All right.
Yeah.
Do you want to enlarge
Yeah, you
that?
can continue, sir.
Yeah, okay, good. My topic for today is the role of public health in preparing for the post-pandemic period. Okay. See, when we think about COVID-19, and then we think about this pandemic, and then we think about post-pandemic period. Are we there? I'm not so sure. I don't think so. So now, do we need to prepare for it? However, yes. While we're not in the post-pandemic period yet, we definitely, as public health professionals, as members of society, governments around the world, international organizations, will need to think about preparing for the post-pandemic period, and especially the role of public health professionals. You at STIKIM, Universitas Indonesia Maju, doing a great job by organizing this. I'd like to congratulate Dr. Hafiz, Dr. Rizki, Nina, and the team here for organizing this very timely webinar, and for me to invite me to talk on this role of public health in preparing for this post-pandemic period. Can you next slide, please? Right. See, when I think about the COVID-19 post-pandemic period, I definitely have to think about this pandemic itself. We really need to understand how a disease that did not exist 2 years ago, that did not exist more than 2 years ago, suddenly, or just existed, right, had become such a big problem, has caused a crisis around the world. Here is COVID-19 emerging in Wuhan, only in December 2019, as a pneumonia of unknown etiology. And suddenly, in 3 months, this disease, right, travels all around the world, gets spread to many, many countries around the world, needing WHO to give it a status of a pandemic. In fact, for some, of course, there are a number of pandemics that have happened in between. We straight away go back to basically the last pandemics and how to handle this, right? And straight away, and I remember very clearly, all right, this is mid-March. We were in Malaysia. We were having our own Sanggar Kerja, a working group within the department. We had gone out for that, right? So here now, what has the world done? So we also need to think about this. Response, okay, quarantine, lockdown measures got introduced globally. There was suspension of flights. Nobody could travel. Large gatherings were not allowed. Face masks in many countries were being introduced. Social distancing. And here you are especially talking about working population, and also in the context of school. And actually for the last 2 years, most of my teaching has been online. You ask yourself, as students of public health, did we ever think that what we are taught in public health would become so important suddenly? Now everybody knows about social distancing. Everybody knows the word epidemic, pandemic. They know about quarantine. They know about vaccinations, right? And suddenly here we have this pandemic showing how important public health is. In Malaysia, March 18, 2020, I remember just one day before that, we were announced, suddenly we had the Sanggar Kerja and they announced, oh, please go back. And there's going to be a lockdown, a movement control order starting on March 18th. And all of us had to go back to campus. But if I'm honest, I do not know about you, the audience, but for me and my colleagues at Cyberjaya, we never ever thought that this problem, this disease, will ever take so long. And it's still not over yet. We all thought at that moment, I think, okay, this disease has come 1 month, 2 months, 3 months, but nobody, right? We're thinking, okay, that we need this disease and it needs to be planned to manage this, all right? Now, of course, we have got these various measures that we introduced: social distancing, teleworking, quarantine, vaccinations. Now, when we plan for the post-pandemic period, we will ask ourselves, which of these measures that we have introduced, do we still remain? Do we need to still continue to work from home? Do we need to do homeschooling? Do we need social distancing? Because now we see many countries now are already saying, I think a lot of this not necessary, but vaccination, of course, has come in a big way. And I like what Dr. Miley's presentation just now, excellent presentation, talking about this COVID-19 problem. So our question is, which of these measures need to be introduced? Need to continue to be introduced, and which new measures need to be introduced? Okay, next slide, please. Has this problem gone away? Look at this global situation. Just 2 days ago, if I think about it, as of 4th, this is the world meter. I mean, I'm sure all of you know about this. There's a very clear global world meter talking about every day the number of cases that are there. And as of 4th, right, that's just 2 days ago. Basically 388 million confirmed cases, of which 307 million survived. Recovered. That is 98%. 2% died. Okay. Now the question is the situation still there? Is the pandemic still on? Yes. We have 74 million active cases, new cases every day. However, the good thing is 99.9% of them are mild. The Omicron, especially the new variant that's out there, mild, with 0.1% of them being serious or critical cases. Has it gone away? No. Daily, we still have over 3 million cases and many deaths. So, yes, we now are in a stage where we need to address both the pandemic situation and to prepare for a post-pandemic situation. So we need to have a better understanding of what is going to happen. Next, please. Right. Has the COVID-19 pandemic come to an end? No, clearly not. Total number of new cases beginning to decline, and that's a good sign. Total number of new cases for the first time, actually, of course, there are perils that are there, but consistently for the last 2 weeks have been declining. However, burden of active cases are still high. Good sign that has led to a lot of countries having a rethink is this percentage of serious and critical cases on decline. Because it is this serious and critical cases that have actually inundated, flooded our healthcare system, causing the healthcare system to be overburdened and for us to be kind of rushed, or we need all whatever resources that are there to manage this large number of serious and critical cases. And the good sign is it is coming down. So because of the serious and critical cases coming down, and of course many other variables, when governments decide, they don't look at just one measure, governments are beginning to adopt new strategies. Like in Europe, we know, or many countries in Europe have said, back to normal. Exist as though you have a pre-pandemic stage. No more social distancing going on. Masks, some countries said, no, not necessary. Back to school, back to work, no more working from home, right? And many parts of the world are already, especially in Europe now, it's already there. And in other parts of the world where the cases are still there, people are wondering, what next? How do we handle this? What is the scenario? And the word I think would be the scenario. Next, please. Okay. So if we want to develop a scenario, all right, we have to think about what are the challenges that we faced and the measures taken, including lockdowns, movement control orders, limited family and social gatherings, right? And definitely we found that public health professionals, you and I together, we work in this area. Somehow or other, we were unprepared for this. We thought, we always feel very comfortable, public health, we're doing a great job, yes. But for this catastrophic event, pandemic event, we are not ready. And especially in the early phase of the pandemic, whatever responses that were being carried out were ineffective. And one of the reasons, here I'm quoting one of the, I'm citing somebody else, I'm using his words. Policymakers had failed to understand the technological, economic, and healthcare consequences, and especially the behavioral responses needed. We, policymakers, I think somehow or other, we still are we're still not good in understanding human behavior yet. Yes, behavioral education is important. We say that. We're talking about behavior-based approaches, especially in workplaces. We're talking about that for safety and health, right? But this interrelationship between the technological, economic, and healthcare, we have not looked at it. And this especially the complex and long-term consequences, right? We're not ready, or we are not very much attuned to understanding this. Okay, next slide, please. So now, if like today, I've been asked to present on a public health, role of public health in the post-pandemic period, right? And I say it's not really over, the pandemic is not over. Yes, but we still need to prepare for the post-pandemic period, right? So we need to understand that we as public health professionals or government policymakers had failed to look at the interrelationship between the social issues that were there, the technological issues, the healthcare dimension, the economic dimension. Because if we have had lockdowns, movement control orders, businesses have been closed, schools closed, entities closed, loss of income, unemployment. How long can it go on? Right? So now it is very clear that somehow or other there needs to be coordination among societies, among the government, within the government, in different agencies, to look at and address the post-pandemic scenarios that will emerge. We're not even sure what the scenarios are, and I'll talk to you about that afterwards. So of course, there's whatever coordination and governance must be carefully planned, carefully pursued. And only if there's coordination and there's good governance, right, will it be a precondition to effective public health intervention. If there's no good coordination within the different government agencies, right, and governance is poor during this period, or the post-pandemic period too, right, we cannot have effective public health interventions. So we definitely need to have good coordination and governance available. And we realize, and here I quote this author, the less systematic the redesign of the system is, right, is the slower and more ineffective it will be there, then the deeper the inequalities will become. See, we all know that during this period, during the pandemic period, the last 2 years, there has been an increase in socio-economic inequality. especially those in the lower income group, very, very badly affected. Of course, those in the higher income group, very high, then yes, of course, they would have been affected, their businesses would have been affected, they would have lost money, but not to that extent where all of their livelihood is gone, putting food on the table, having a roof on top of the heads is an issue. So we need to make sure that whatever we do, we cannot afford to have increased socioeconomic inequality, right? And of course, structural adjustments we need to be made. Okay. Can I go back, please? One slide, go back. Right? And finally, of course, the recovery will fail into less and less effective scenarios. So if we do not have a good systematic redesign of the system, what is going to happen? Whatever public health interventions that we are going to make will not be so effective. This next slide, please. All right. This here, I would like to actually cite this paper by Sakwa. And I must say, a lot of the ideas I've taken are coming from this paper that was published just last year, all right, on plausible recovery scenarios. Because if I want to plan for a post-pandemic period, I must have a good idea about plausible recovery scenarios. What is the situation during the post-pandemic period? And they have used very good analytical methods. And they believe that data analytics and the analytical methods are going to be very important for us to have optimal or above optimal scenarios. Currently, of course, if nothing is done, we'll end up with a suboptimal scenario. The aftermath will be the global economic system will start to fail, right? And of course, there won't be economic recovery for long periods of time. Economic stagnation will be there. Political narratives will change. Okay, right? And of course, these socio-economic inequalities I talk about will be exacerbated. And of course, at that time, when your socio-economic inequalities are there, nobody is going to be thinking about environmental challenges. Of course, we talk about SDGs and we all know about that. However, so we need to have some kind of optimal scenario. And everybody is using the words for a long time, the so-called new normal. What is the new normal? Yes, the economic recovery package has been successfully put in place. We have come to pre-crisis levels of the economic activity. That means before the pandemic, what was the economic activity in a country? Just like in Indonesia, in Malaysia, in Europe, in the US, wherever, what is the economic activity going on? Heavy. And we need to come back to that pre-crisis levels for the new normal. And of course, there will be new guidelines for public life. And this whole organization of social and economic life will have to take in these new challenges. We cannot afford to have breakdowns in the system. See, very simple. Whether we like it or not, we have to admit there was breakdowns in the system. And not only in public health area, but in the financial systems and in different areas. Of course, what would be the best Sakwa and his colleagues and then Domenico talk about is a coordinated multi-layered approach with social and technological innovation. New ideas will have to come about, right? And these new ideas must come with strong public support. And this will lead to a new growth cycle. Economy has gone down. We need a new growth cycle. And what we need are innovations in working, in our workplaces, really emphasizing on that, innovations in education, and also movement redesign. Hopefully, with these innovations that have come about, right, we'll have a positive impact also on. So public policies will need to be developed so we end up with an above optimal condition. But if we're not able to, at least we should work for an optimal and going back to a new normal. Okay, next slide, please. All right. Now, these are the things that we are thinking about and what Sakwa and his colleague Domenico talks about, right? we know that the pandemic, right, has compromised our essential health services. See, when you talk about the US, Europe, Asia, Malaysia, Indonesia, and then on the other side, we look at Africa, South America. Many countries in the world have got completely disruption of the delivery of essential health services. So during this post-pandemic period, from the lessons that we have learned, during the pandemic, right, we need to enhance our public health infrastructure. Okay, so the public health services and roles will need to be enhanced, right? Some of the areas that talk about information sharing. See, the good thing, of course, right now, that I can give you the COVID-19 figures of yesterday or the day before, when this is WHO's kind of thing. This is information sharing. Globally, everybody is reporting the total number of cases that are there, the total number of new cases, total number of deaths. To think of it happening before that, not so easy. Okay, public health measures to be included. Protecting healthcare workers. You see, for me, I come from an occupational health background. For us to think about indoor ventilation in the hospitals, in healthcare settings. There's not much discussion before that. The use of personal protective equipment, PPE, has become a household name now. Use of masks. Okay, we all talk about hierarchy of controls and all that. Isolation is one very clear hierarchy of controls within. And here we're talking about social isolation at home, right? Social distancing happening. Okay, behavior change, right? And of course, reliable supply chain. See, we have vaccines. And for vaccines to be effective, the cold chain system must be effective. The supply chain must be effective. Otherwise, no. Now I will talk about a few specific areas which need to, and we in public health need to think about. I know Indonesia, Malaysia, and all countries in the world, or most countries in the world, would have had a national health emergency preparedness and response plan, even before the pandemic. But nobody ever thought that we would need it to be in place in a short period of time. Within 3 months of a disease emerging, a non-existent disease, a new disease emerges, given a name called COVID-19, right? Spreading so fast and becoming a national emergency. So we need to think about and update the plans that existed. We need to think about rethink the role of hospitals. We all know that hospitals were inundated with patients. You see, we always think, oh, we have always hospitals, minus the district hospital, general hospitals, specialist hospitals, district hospitals, or just smaller hospitals, private hospitals, right? But during this time of the pandemic, we did not only depend on hospitals. A lot of new areas got opened up. Community centers were opened up. Stadiums were opened up to basically house patients, to take care of patients, or even what do you call them? These vaccination centers, right? PPVs, vaccination centers, large-scale vaccination centers opened up. Whoever thought? I mean, yes, I like Dr. Miley's the video of that outbreak kind of thing. Did we ever think we'll need to do that? Another thing that had emerged is this whole question of a surveillance system, a good, effective surveillance system, especially linking with the laboratory. That is to say, when anybody got tested positive, I know in Malaysia we have a My Sejahtera system. Anybody who gets tested positive immediately is not only here, but the labs inform the system, or the patients, the individuals who tested positive inform the system, and everybody, in fact, their contacts also get informed, because we have this My Sejahtera, everybody gets registered. Okay, so Then, of course, we need to think about other public health systems that are there. We need to update public health laws. Next, please. Next slide. Next slide, please. I don't see a slide moving. I've got 3 more slides here. Hello?
Yes, sir. Please wait a minute.
No
because,
problem.
we have a problem here.
Don't worry.
And you have 3 minutes
I know.
left.
I
Yeah,
know.
okay, sir.
But I need to my the slides. Next slide. Okay, it's not clear. I can't see it. All right. This is a good thing. In addition to this, looking at new public health laws, our curriculum in public health schools, in medical schools, will need to be updated. Suddenly, we have got to, and we need to develop new competencies, especially within public health schools. Our curriculum will need to be re-looked at. There will be needing for distance learning and e-learning that's happening. But most important, I think, is effective risk communication. I think we need to strengthen effective risk communication, because what has happened was during COVID-19, there was a lot of false communication that was going on, and everybody was very worried whether this, whatever is said, true or false, this true or false, does vaccine work or not? Of course, for me, it works, but a lot of anti-vaxxers out there also working at the same time. So a lot of this community-based anti-vaxxers, other groups that are there, posing a problem. So we need to have effective risk communication and also community-based education, communication. And next, please. Next slide. Last slide there. Before conclusion. All right. See, this during COVID-19, a lot of research has been carried out on COVID-19. This work that's been going on COVID-19 can be extended to other infectious disease too. We need to continue to do research on policy making, looking for evidence-based solutions. We need to continue a great work that has been going on vaccine development. Many countries now can develop vaccines. We need to think about better surveillance systems and AI. How do we better use AI and surveillance systems? So next, in conclusion, so we've got many areas that I need to think about within the public health area: good surveillance system, public health laws, medical curriculum, right? So of course, what approach you in Indonesia, we in Malaysia, or many countries around the world will depend on the scenario. Okay, and this scenario will depend very much on the epidemiologic situation and how much the country is prepared for it. So in conclusion, each country will need to assess and start planning for public health measures to be implemented, but this must be done in an integrated fashion with all government agencies and international organizations. Okay, with that, I'd like to thank you. I think my time is just up. Within my time. Thank you very much, Rima.
Thank you very much, Professor Rampal. You saw us the global situation about COVID-19 cases, and by seeing that we are expected to be able to plan what will we do next. Yeah, and the very important matter is the most important things to do is how to make a good coordination and governance. Thank you, Professor Rampal, for your presentation. Now we will continue to the discussion session that will be assisted by Mr. Barik Rabani. Mr. Barik, time is yours.
Okay, thank you very much, Prof. Rampal, for such an interesting presentation. very useful information for all of us to learn. So here we already have an audience who want to ask, Prof. Okay, for the first question is from Sigit Setiawan. Here I will translate it for you into an English. The question is, what is the best strategy to force the public to comply or to obey with health protocols to deal with the COVID-19 pandemic in a democratic country like Indonesia?
Thank you very much for the question. I think a very valid question. See, I think whenever we want behavior, this is under behavior change, right? We have something out there called social distancing. We got something out there wearing a mask. We got something out there, get vaccinated, right? Each one of these is going to need action by the public. And that's why what is the best strategy to get people to comply? I think if we are able to and reduce the gap between what is called real and what is perceived. See, what is the real situation of COVID-19 must be continuously explained to the members of the public. And not only that, and the members of the public need to have trust in the agency providing that information. So trust and credibility of the organizations and the agencies providing this information becomes very necessary. That means, like if the Ministry of Health is the source of that information, that there must be good trust and credibility of the Ministry of Health. So people should not suspect that these government agencies have their own political agenda, or these are driven by ministers or whatever, so that they need to believe in what is being said. This with regards to mask use, some people say, why do I need to run? And even I remember in the beginning, because there was a debate about droplet infection versus airborne. And this whole question also was there. Do we really need a mask? Who needs a mask? Both sides or the person who's infected, right? Similarly with social distancing, whether it's 1 meter, 2 meters. And the message has to be consistent. Vaccination, we definitely have to fight the anti-vaxxers out there to show how effective the vaccines are. Of course, the problem has been, and which is true, is, all right? The problem is, and which is true, is that these vaccines, of course, were approved on an emergency basis. To develop a vaccine normally takes a number of years. It doesn't happen in 2 months. And here's a disease that's out there, all right? Within a year, we're out with vaccines, okay? And not only that, and the vaccines have big challenges because new variants. Vaccines were developed for one variant, now new variants are coming out. How effective are they? So people need to be told about each one of this in a truthful and honest manner so that they can have trust and credibility. Okay, the strategy will be increasing trust and credibility of information giving to increase the gap, to decrease the gap between what is perceived and what is real. I hope that answers the question.
Okay, thank you, Prof. Rampal, for asking the question. Okay, there is audience at me Mufika. Can you open your cam and ask to Prof. Rampal, and I will translate your question directly. Can you do that at me Mufifa?
Halo, selamat siang.
Okay, thank you. Admi Mufifa, what is your question? You can use Indonesian language and I can translate it directly into English.
Oke, terima kasih. Mohon izin, maaf tidak bisa open kamera karena sedang di kantor. Baik, pertanyaan saya untuk Prof. Rampal, bagaimana kebijakan pemerintah di Malaysia terkait persiapan post pandemik di sana, dan maksudnya bagaimana koordinasi antar pemerintah terutama untuk Ministry of Health ya, dan kemudian bagaimana tenaga kesehatan di sana diarahkan untuk kesiapan tersebut. Baik, kurang lebih seperti itu Kak, terima kasih banyak.
Okay, thank you, Mbak at me. Okay, Prof. Rampal, I will directly translate into English. The question is, how is the government policy in Malaysia related to post-pandemic preparation, and how the health workers there are direct to that readiness? Okay, that's the question.
Okay, all right. See, we know right now we had actually come to a peak of about 30,000 cases, right? Then we are right now, then we went down to about a few hundred and then a few thousand. Right now, yesterday we had 7,000 cases. We also predict, I think the government, the Ministry of Health is kind of aware that the number of cases expected are expected to increase because of the Omicron. However, we know that Omicron, the nature of the illness is not so serious, right? So it is a very difficult decision, okay? How to prepare for post-pandemic, like it will all very much dependent on the scenario that is there, the number of cases that is there, the nature of the disease, or whether is our healthcare system being flooded or not. So the government now says, okay, I think at the moment we are in a very good situation, but now whether we're going to open up our country to tourists or to others, we have to wait and see. Like in Europe, right, like in Norway, where my daughter lives, right, they have about 30,000 cases a day at the moment. And they are 1/5 the population of Malaysia. Whereas in Malaysia, when we have 5,000, that means it's like, cases, we are very worried. There with 30,000. And what they have decided is to last week, the Prime Minister there announced, as far as they're concerned, everything is back to normal. All go back to work, schools open up. You don't have to wearing masks. Each one of the social, all optional now. That means they're talking about going back to normal. In Malaysia, are we ready for that? I am not so sure. But and so here, what the good thing I must say, I must say the Ministry of Health has been very open. Every day, details of the number of cases are there. What measures are being taken with regards to social distancing, with regards to wearing of masks. And we have a very good My Sejahtera system. It's called a My Sejahtera system where we have on our phone. I do not know whether you can see this, but for me, I mean, what I can do is I can show you this very nice system in Malaysia. Here, it's here, and it clearly states exactly here that wherever I go out anywhere, we have to use a QR code to check in. And in this, it is they say I'm already fully vaccinated. Okay, so here when you look at my vaccination status, also straight away they can see that I'm fully vaccinated. That I'm already fully vaccinated. So essentially, this and I think this setting up this My Sejahtera system was a very good system that is there. Now, with regard to healthcare workers being prepared, yes, it is said that healthcare workers had to go through a large brunt of the disease in the initial period when the healthcare system was flooded with patients. They had to work overtime, 1 day call, 2 days call, all right? And I think nobody was really prepared for this pandemic, if I'm honest. But now, over the period of time, measures are already being taken. Healthcare workers are being trained on this and how to manage. Things are definitely improving. I hope that answers. But now, are we ready for a full, this one? The government, I mean, the Minister of Health yesterday or 2 days ago announced that basically they are monitoring the situation. And the monitoring the situation will depend on the kind of the number of cases that are out there, and whether any new variant, because nobody can say anything. At the moment, we say Omicron, right? Is there another new variant? At the moment, I don't think so. I think we are on the disease is coming to an end. I mean, the lifespan of the virus, I mean, or the whole, right? But if anything happened, I guess, I mean, we're still working within the unknown. We're still working with the unknown. But Ministry of Health, I think in Malaysia, they have done a fairly good job. Yeah, I think that's my conclusion. See, when I go out, I wear a mask. Every member of my family wears a mask when we go out. right? We do our social distancing, right? We are all vaccinated. I've got my booster. My wife has got a booster. My children have got their booster already, right? Booster with the 3rd dose. So well done, very well prepared. Okay.
Okay, thank you, Prof. I apologize. We have to suffice for only 2 questions because
No
of
problem.
the
Thank you.
time limitation. Okay, ladies and gentlemen, that's the presentation from Professor Dr. Krishna Gopal Rampal, which discussed about the role of public health in preparing for the post-pandemic period. Before we end this presentation, I will try to conclude the results of the seminar presentation. Okay, based from the question. Okay, so in conclusion, we need to have some behavior change. Each one of these are the exchange we need to reduce. So for the second question, we know that Omicron is serious. It is very difficult to prepare in post-pandemic, and number of cases of disease, the government at the moment have very good situation. We have to wait and see. In Malaysia, also, we are ready for that. So that's a good thing. The Ministry of Health are very open every day for the information. Very good system there. Very nice system on Malaysia. So there are also information about vaccinate are very good system. Yes, it prepared to go through large disease. They do a very good job there, and also do all social distancing and etc. Okay, ladies and gentlemen, once again, we would like to thank the presenters and also the attendees who have participated in this seminar. Finally, I, as the interpreter, will give it back to the moderator. Thank you.
Thank you, Barik. Thank you very much.
Okay, thank you, Mr. Barik, for guiding our discussion session. As our appreciation for the speaker's appearance in this webinar, we will give certificates to Professor Rampal. Prof, you can see the certificate on the screen.
Yes.
Yes.
Thank you very much.
Okay.
Thank you very much.
Thank you once again. Thank you, Professor Rampal, for the information that if been shared is useful for all of us. So see you next time, Prof.
Thank you.
We
Thank you to
will.
the University of Indonesia Maju, Department of Public Health for inviting me. Thank you again.
Yeah. We will invite you to take a picture with us, sir.
Yes.
And Miss Valentina will lead us to take a picture. Valen, are you ready?
Ready? Okay, ladies and gentlemen, we will take the documentation. Please turn on your camera. Ready? 1, 2, 3. Second page. 1, 2, 3. Okay, finish. Thank you.
Thank you.
Okay, sir. Thank you so much. See you next time, Prof.
Okay, I can leave. Thank you very much. I'll leave.
Okay, next we are going to continue. Yeah, thank you. Thank you, Prof. Okay, next we are going to continue to the next panel, which will be guided by my partner, Mr. Siswa Anton. Time is yours.
Okay, thank you, Ms. Rima, for guiding first sessions of discussion. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen, discussion from our speaker. Please allow me, Anton, as a moderator, to introduce our two speaker discussion in this panel. First speaker is Dr. Harimat Hendarwan, Magister Health. From your screen, we see that Dr. Harimat is highly expertise in the public health. Is doctorate Public Health Science University, graduated 2010, and also Mr. Harimat has many publication. If you see, they have like almost 5 in screens. The last his publication is assessing the COVID-19 diagnostic laboratory capacity in Indonesia. And also, Mr. Harimat has various work history. Last work history is researchers in the Health Research and Development Agency, Ministry of Health 2000s until present, and also he is WHO expert as a panel member of Global Strategic. Okay, then Mr. Harimat also has intellectual property rights. Dr. Harimat memproduksi beberapa buku seperti yang bisa kita lihat. He has 3 books already produced. Okay, then second speaker. I will introduce second speaker, Miss Fitria Kurniasari. She is a doctoral candidate from Nagoya University, and then work experience is a researcher's assistant at Occupational and Environmental Health Department, Faculty of Public Health, University of Indonesia, since July 2017 until July 2018. Also, Ms. Fitri has a research handle as inflammatory biomarker assessment on heavy-duty machines, and also various projects handled by Ms. Fitri. You can see in the screen as she's the assessment of baseline data occupational health at Medco IP Simenggaris. Okay, let we continue to first presentation. We welcome Mr. Dr. Harimat to present about the regarding how forming of healthy culture after the pandemic among the community. Please welcome Dr. Harimat.
Okay, thank you very much, Pak Siswa, and good morning to all participants of international webinar. First, I want to check my voice is clear, Pak Anton.
Yes, we hear you clearly.
Thank you. Okay. Thank you for the opportunity that was given to me to be able to present my presentation about forming healthy culture post-pandemic in the community. Can I have my screen, please? Okay, thank you. Next. I will begin with the data. We already understand since long before the COVID-19 pandemic, the use of masks and hand washing had benefits in reducing diarrheal disease and respiratory infection. As we can see here, the data from Ijmot et al. 2008, from 14 randomized control trials proved that intervention promoting hand washing resulted in 29% in reducing in diarrheal episodes in institutions, especially in high-income countries, and 31% reduction in such episodes in communities in low or middle-income countries. The other evidence coming from Freeman et al. 2014, which meta-regression of risk estimates suggest that hand washing reduced the risk of diarrheal disease by 40%. Also, we can see here also, Yellow et al. 2014 stated that the improvement in hand hygiene resulted in reduction in gastrointestinal illness of 31% and reduction in respiratory illness of 21%. And from Taiwan, from Choose Research 2020, we get information that there is a significant decrease in cases of influenza, enterovirus, and all-cause pneumonia during the COVID-19 pandemic. Wearing a mask and hand hygiene and also make social distancing might contribute not only to the prevention of COVID-19, but also to the decline of the other respiratory infectious disease and also, of course, diarrheal disease. Next slide, please. This is the data from the National Survey of Basic Health Research 2018. Of course, before the pandemic, the data from before the pandemic. As we can see, only about 50% of the population at 10 years and over who have a good behavior in hand washing. The meaning of the washing hand properly Here is washing hands with a soap, with running water before preparing food, whenever hands are dirty, such as the holding money, animals, and gardening, after defecating, after locking the baby or a child, after using pesticides, before breastfeeding the baby, and also before eating. You can see here the Bali province became the province with the best proportion nationally, and East Nusa Tenggara province became the province with the worst proportion. From this data, also seen that the higher the level of education, mean also the greater the proportion good behavior in hand washing, as well as population in urban areas and female. Next. Okay, from the Central Bureau of Statistics and National Institute of Health Research and Development, indeed, this data has been a long time at the beginning of the pandemic. But I think it may still can give a picture on how the population behaves in compliance to keep their distance, use masks, and also wash their hands. 70% people have kept their distance in the past week. 80% people often or always wash their hand with soap for 20 seconds, and 64% of respondents often or always use hand sanitizer. 80% people often or always wearing masks when outside the house. And you can see here also, interestingly, for these three parameters, the proportion of women is always greater than men. You can see also the higher the age, more obedient respondent in behaving in fulfilling the appeal. From the risk perception survey in 5 provinces, there is a variation in the level of risk perception between provinces. On average, only 3 to 5% of the population in the province is not worried about the coronavirus, but 15 until 30% of the public feels not at risk of contracting it. I think it is the important information from that. Next. Okay, based on our centuries of experience, outbreaks such as the Black Death, Spanish flu, HIV/AIDS, and also cholera, and most recently COVID-19, ultimately awaken us to the need for behavioral change and adopt the new health protocol. This process, of course, requires massive and continuous community education. Next. Okay, from the COVID-19 experience, there are 3 main behaviors that are closely related to the COVID-19 pandemics, namely the use of masks, keep a distance, and wash hands with a soap. Message related to the use of masks emphasize the importance of the use of masks both by sick and healthy people that can reduce the risk of disease transmission. If both use masks, it can reduce the risk of transmission by only 1.5%. It is also important to convey how to choose a good mask, how to use it, and how to replace it. Due to keeping the distance, people should avoid handshakes or crowds, and institution might also establish work from home policy for some or all their employees, limiting the numbers of meeting participants, not holding mass activities, establish the protocols that not eat or drink together, and forming a task force. Government also can make a policy for eliminating the crowd, social restriction and study from home. Next slide, please. And now, how to change people's behavior. I think there are many theories or models, but maybe I put some. The first is the health belief model. I think this is the one of the best known and most widely used models in health behavior research. Actually, the health belief model is a social psychological health behavior change model, which developed to explain and predict health-related behaviors, particularly in regard to the uptake of health services. The HBM was developed in the 1950s by social psychologists from the US Public Health Services, including Irwin M. Rosenstock and Howard Leventhal. There are some components of HBM. First is the perceived susceptibility, refers to subjective assessment of risk of developing health problem, and perceived severity refers to the subjective assessment of the severity of health problem and its potential consequences. And perceived benefit, health-related behavior also influenced by the perceived benefit of taking action. Perceived benefit refer to an individual assessment of the value or efficacy of engaging in a health-promoting behavior to decrease risk of the disease. And perceived barriers. Health-related behavior are also a function of perceived barrier to taking action. Perceived barriers refers to an individual assessment of the obstacles to behavior change. Perceived behavior to taking action include the perceived of inconvenience, expense, danger, such as side effect of medical procedure, and discomfort, such as a pain, emotional upset, that involved in engaging in the behavior. And the other is modifying variable, individual characteristic, including demographic, psychology, psychosocial, and also structural variable can affect the perception of health-related behavior. The other is cues to action. A cue or a trigger, I think it is necessary for prompting engagement in health-promoting behavior. Cues to action can be internal or external. The last is self-efficacy. Self-efficacy refers to an individual perception of his or her competence to successfully perform behavior. The second model is the trans-theoretical model. I like this model much because this is a systematic put the people into 6 classification. The first is the pre-contemplation. Pre-contemplation in this stage, people do not intend. We highlight the term of people do not intend to take action in the foreseeable future, defined as within the next 6 months. So in this stage, people do not intend to take action. The second stage is contemplation. In this stage, people are intending to start. This is the different from the earlier stage, pre-contemplation. In the contemplation stage, people are intending to start the healthy behavior in the foreseeable future, defined as within the last 6 months. In this stage, people recognize that the behavior may be problematic. Even this recognition, people may still feel ambivalent toward changing behavior or not. The third stage is the preparation or determination. In this stage, people are ready to take action within the next 30 days. And the next stage is the stage of action. In this stage, people have recently changed their behavior. And the next stage is maintenance. In this stage, people have sustained their behavior change for a while and intend to maintain the behavior change going forward. People in this stage work to prevent relapse to earlier stage. And the last stage is determination. In this stage, people have no desire to return to their unhealthy behavior, and they are sure they will not relapse. Okay, I think there's still many theories there, but I think it is enough for me to give in this term to explain those 2 models. Okay, the next slide. The other widely used theory, especially in Indonesia, is a Lawrence Green theory. There are 3 factors that affect the health behavior. The first is a driving factor, or we know it as the predisposing factors. Predisposing factors are factors that become the basis of a person's motivation or intention to do something. The driving factor include knowledge, attitude, beliefs, values, and perception, tradition, and other elements contained in individual and communities related to health. The second factors is enabling factors. Enabling factors are the factors that enable or facilitate behavior and action. Enabling factors include facilities and infrastructure or health facilities. And the last is the reinforcing factors. Reinforcing factors are factors that encourage or strengthen someone's behavior due to attitude of a husband, parents, community leaders, of health workers. And then in addition to driving factors, reinforcing factors are affected by regulation and also by supervision. Next slide, please. Okay, the task force of COVID-19 in division of behavior change divides people into 3 categories: obedient, half obedient, and disobedience. Obedient mean people who consistently run health protocol. Half obedient mean people who have not been consistent in implementing the health protocols. And the disobedient is people who do not run health protocol. Of course, the obedient people always wear a mask, keep social distance or avoiding crowd, and routine washing hand, go out of the house just to do important activities. The half obedient not always using mask, not always also keep social distance or avoiding the crowd, and not routine washing hand. Sometimes just go out of the house to do that activities which do not too important. And for the disobedient people, they are not wearing a mask, social, and not make a social distance or avoiding crowd or washing hand, and go out of the house to doing activities that not important. Next, please. Okay, habituation and culture. According to the task force of COVID-19, there are several stages to civilize behavioral change, starting from conveying knowledge and understanding of this behavior change. First is the thought, how to wash hand and danger dirty hand. For the example is the washing hand properly. And the other step is a customize, and then train to consistent, become a habit, and become a character. And in the top of the step is become a culture. Next, please. Okay, then since we still have people in our community that is still half obedient and disobedient, makes the need for efforts to change behavior. First, it needs to be seen whether the intervention is effective and efficient. If we already sure that the intervention is effective and also efficient, it was assessed and raised political support, institutional support, and individual support for the change behavior or for the intervention that we sure that it is effective and efficient. We have 4 main activities to implement behavioral change. First, the carrot. So from the carrot, it's mean the true incentive, give an award for people who do not that expected, and then the whip, through the prohibition, unwanted behavior as something against the law, and the third is the sermon, through a massive information campaigns, tell people what expected behavior, and the nudge, encourage behavior that expected to be an option which is easy to do. The whole thing is targeted to the individual, family, institutional area, and the community. The last slide, please. And how we can do that? Many activities that we have not to make a civilized of the changing behavior, such as dissemination of information through various communication channel, sharing information to social media group through serial film, short film, TikTok, radio, television, etc. And distribute brochure, leaflet, poster in various points or location, and public service advertising involving leader, community figures, indigenous figures, and religious figures. Role models, appreciation, warn of public penalties if they do not comply with protocol, put sticker obey 3M at people's house, ban of community activities which violates the health protocol, enforcement of health protocol rules, and one thing, the important thing also, behavioral change with goals, individuals who are in the education unit starting from early childhood education to higher education. Disseminate information directly to individuals who are in the education unit with use the educators, such as teachers or lecturers, and ensuring the implementation of health protocol in the education unit, and also incorporate health protocols and clean and healthy living behavior into teaching materials. Okay, so the next slide. Okay, thank you very much. That's all my presentation, and also thank you for your attention. Now I giving back to the moderator. Thank you very much.
Thank you, Pak Harimat, for such a great and an outstanding presentations. Your presentation enhance us to change our behavior, which is behavior can change, need political willing, also institutional willings, also, and also from individually. And also you give a proof to us that the scientific proof that 3M, which is that is using mask, wash your hands, and also keep it social distancing, can reduce number of various coronavirus outbreak diseases. Okay, maybe from audience has many questions about your presentation, but we need to postpone it. We will continue to our second presentation from Ms. Fitri. I invite Ms. Fitri to deliver presentation.
Okay, thank you very much, Mr. Anton Saputra, for giving a very nice introduction. Please let me share my slides. Oh.
We already assigned you as a co-host, so.
Okay. Can you be able to see my slides clearly?
Yes, I will see your presentation, and also I hear your voice clearly. So
Okay.
You can continue.
Okay, nice. Okay, so good morning, everyone, ladies and gentlemen. First of all, I would like to say thank you very much for Sekolah Tinggi Ilmu Kesehatan Indonesia Maju for inviting me in this international webinar with other incredible speakers such as Pak Harimat in this session. So, okay, after listening to very wonderful and very educative presentation from other speakers, such as from Prof. Meli at first, and then Prof. Kampal, and of course, Pak Harimat. Now let's a little bit relax in my presentation since I don't bring a very heavy topics for today. Today, I just want to share my experience living as student during COVID-19 pandemics in Japan. So hopefully by this presentation, other people will understand how the COVID pandemics in other country, and also maybe if other students also interested to continue their study in Japan or in other country, it will be useful for them. Okay, I will move to the next slide. This is the outline of this presentation. So first of all, I will have the introduction and then the COVID-19 pandemics in Japan. And then I will also talk about the regulation on COVID-19. And then the next one is life in Japan before and during the pandemics. And then the obstacle that is happened during the pandemics. And also I will talk about the supports from the government as well as the university and the vaccination. And the last but not least is tips to survive. Okay, let me have a short self-introduction. So as previously mentioned by Mr. Anton, my name is Fitri Kurniasari, but everyone call me Sari. I'm currently a doctoral student in the Department of Occupational and Environmental Health, Graduate School of Medicine, Nagoya University. I'm continuing my study under the Japanese government or MEC scholarships. I have been living in Japan from 2018 up to now, and hopefully this is my last year to complete my degree. Okay, enough for the introduction. I will move to the next slide. So maybe some of the audience here never heard about the Nagoya University. So where is Nagoya University actually? Nagoya University is located in the Aichi Prefecture and very specifically in the Nagoya city. This is the third largest city after Tokyo and Osaka. And currently Nagoya University has national rank number 5 nationwide, and it has 3 campuses. The first campus in Higashiyama campus, which is main campus, where almost of the faculty are located in this campus. And then the second one is Surumai campus. This is only for the medical school and also the hospital. This is where I'm studying right now. And then the third one is Daiko campus. Okay. So since today I want to share my experience living in Japan as a doctoral student, so maybe it's better to have the overview how life as doctoral student in Nagoya University looks like. So mostly in Japan, the doctoral program is research-based program. So 80 to 90% is research and experiments, and only 10 to 20% is classes and basic training. So it means if the COVID pandemic affected my study, maybe it will be more affected my research and experiments rather than the classes and basic training. So interesting thing in Japan is that laboratory in the university is open for 24 hours every day. And every student can enter the laboratory anytime they want, even though in this pandemic situation. So as far as I remember, it was just only closed for about 2 weeks in the early of the pandemics, and then it gradually becomes like normal again, even up to today. Okay, and I will move to the next slides. So this is the history and also the recent situation of the COVID-19 pandemics in Japan. So the first case of the COVID-19 was detected on 16 January 2020. And from the first case up to today, there are 6 times of the waves of the COVID-19. So the first wave is around January to March 2020. The second wave is around August 2020. The third wave is in the transition between 2020 and 2021. And the fourth and fifth waves is on April and September 2021. So what happened in the recent situation? So currently we are in the 6 waves. So this is the data that I took last week in January 29. As we can see here, the new cases that could be detected is almost 85,000 people per day get infection. And among these 85,000 people, about half of them are requiring hospitalization. This is due to the spread of the Omicron variants in Japan. So, but fortunately that only 43 into 44 people are reported as the death cases. So if we can see the confirmed cases by prefecture, Aichi Prefecture, where the Nagoya University is located, is ranked number 5 after Tokyo, Osaka, Kanagawa, and Saitama. Okay, I will move to the next slide. This is the overview of the COVID pandemic in Japan from the first case up to today. So to handle the COVID-19, actually Japanese government has several regulations. So the most important regulation is the declaration of state of emergency. This state of emergency could be declared either nationwide and also only in some prefecture, or we call it as quasi-emergency. So since 2020, Japanese government has been declared state of emergency for nationwide for 4 times. And for the current situation, because of the spread of Omicron variants, now we are under quasi-emergency, and Aichi Prefecture is also included in this quasi-emergency state. So what happened during the state of emergency itself? So actually there are several rules about this state of emergency, but in this presentation, I want to just highlight some important points. So first is the residents were asked to refrain from all non-essential travel and excursion. And second is that all restaurants, shopping malls were asked to close by 8 p.m. But even though a restaurant and shopping mall were closed, the supermarkets and convenience store are running and as usual in principle. Then in the case of the events, the government asked to limit the crowds at spectator events to half of the venue capacity. And also in the case of workers, the government asked company to ensure 70% or more of their staffs are working from home. And then the last, the declaration itself gave the government to the authority to close the prefectural high school, elementary and junior high school. But actually the government decided not to close the school since last year because they considering the physical and also the mental of the student itself. So next, so beside the emergency situation, Japanese government also have another regulation, for example, cross-border travel restriction. So Japan has been closed its border to all new foreign arrival actually since the early pandemics. They opened just several months in the last year, but again, they closed it start from November 30, 2021. As we can see here, Indonesia is listed as one of the subject to denial of permission to enter Japan. So this regulation makes many students from Indonesia couldn't enter Japan for their study, even though they already get accepted in the university in Japan. Or for some cases, some students, they are planning to bring their family members such as husband, wife, or even children. They couldn't make it because of this restriction. I think it's very difficult for them to live separately with their family member. So not only that, Japan also denied the re-entry to foreign nationals with status of residents who have stayed in designated country or regions. So if Indonesia is listed in this designated country, it means that the students that have been in Japan couldn't go back to Indonesia. They can go back to Indonesia, but and then they cannot enter Japan again after that. Okay, so I have been talking about the regulation from the government. So let me introduce about the regulation from the university on COVID-19. So basically, the university will follow every regulation from the governments, but they also have like alert category. So at least in Nagoya University, they have like 3 category of the alert, how to say that. So the first category is A, which is the lowest level. This is the caution level, and the B, which is the high alert, and the C is the emergency. So even though the Aichi prefecture, where the Nagoya University located, is under quasi-emergency, but we are still in the B level, which is the high alert. So the definition of the B level itself is there remain a risk of infection, but the government and the regional authority have not requested school to close. Or an individual infection has resulted in the temporary close of an individual building or department. So it means that since the government did not requested the university to close, so still we are continuing the school as usual. But if there is an infection in the school, then they will close the building, not whole, but only like individual building of the cases detected. Okay, so beside that, Nagoya University also have its activity guidelines based on each individual activities. For example, this one, the educational activity is now in the level 1. It means that after taking the prevention action, all of the lecturer, seminars, experiments, and also practical training were held primarily in face-to-face format. But in the faculty and research activities, it's now in the level 2, which is it's recommended that research activity done from home. And then the next one is administrative work. It is now in the level 1, which is it will be like normal. But meeting and event and gathering is now in the level number 2. It means that it's recommended to be online rather than face-to-face format. And then there are no restrictions for the student to enter the university, but for non-university member, only individual with business on campus may come to the university. And then for the extracurricular activities, only some activities are permitted with the close attention to infection prevention. And then now, this is the most serious one, that domestic businesses and private travel is now in the level number 3, which means that all unnecessary and non-urgent business are prohibited like that. So if there are any changes in this activity guideline, every student will be notified by the email address. Okay, next. So this is the COVID-19 communication system for student or faculty or staff members in Nagoya University. So Nagoya University have the Health Administration Office. This office will report every cases that happen in the university into the local health center. So every student that has some symptoms, or if they are decided that they have to take the PCR test from the medical doctor, or if the local health center identify this student as a close contact, or like if the student living with somebody that is identified as the close contact, or if the student tests positive for infection, they have to report everything to the Nagoya University, the Health Administration Office, and they did not come to the school. They prohibited to come to the school. This is very important because like Nagoya University will further investigate it whether there are any close contact in the university itself and make like further investigation and further deciding whether this building should be closed or not. Okay, next slides. So based on the regulation and based on the current condition, I want to make a summary life in Japan before and during the COVID-19 in the viewpoint of student, of course. So before the COVID-19 classes and scientific conferences held fully offline face-to-face format. But during the COVID-19, mostly the classes and scientific conferences hold mostly online or hybrid. So only the presenter will be face-to-face, but the viewers or the audience will be online. Then also outside of the studying, of course, in Japan, you have to attend many attractions. In Japan, there are many interesting things, such as during the sakura season, there is Hanami party, for example, like this. But during the COVID-19, most attractions are canceled or open with precautions like this. And also before the COVID-19, no travel restrictions, so you can go anywhere you want, or you can go back to visit your family anytime. But during the COVID-19, it's very difficult to go back home, to go back to your home country. And of course, if the number of cases are dramatically increased, university may close anytime. And if the university is closed, then it means that it's very difficult for you to manage your research, your study, yeah, like that. Then, so based on the condition, I want to make a summary of the obstacle during the pandemic itself. So I categorize into several categories. First is about the study and research problem. Second, about the physical problem. Third, about the mental problem. Fourth, about the financial problem. And then the last is about the technical problem. As I mentioned before, that if university is closed suddenly, then it's very difficult to manage the research. Then also, if the university is closed, it will be difficult for you to have proper discussion with your professor. And sometimes your professor was detected as the close contact person and they cannot enter university, and it's also very difficult to communicate with them. And some fieldwork research were mainly canceled due to the travel restriction. So in my case, I supposed to take some samples from Indonesia, but unfortunately it was canceled, and it was very tough for me at that time because it was my main research. And then next one is physical. Of course, if you are always staying at home, working from home, you will have lack of physical activity. And then I want to highlight more about the mental problems. So in this pandemic, of course, you will have a fear of infection. But not only that, as a student, especially if you are under the scholarship in the other university, you will feeling anxious of not graduate on time, which means if you are not graduate on time, your scholarship will be stopped, and you will have no more money to continue your study. And then you will also feeling worry if your family member get infection in Indonesia, but you cannot go back. Like in the worst case, if your family member get infection and then they are, worst case, maybe they are dead, but you cannot go back. It's very difficult for the students like that. And of course, like you will feel isolated if you are just staying at home and then you don't have communication with your friends, for example. And also I want to show you the financial problem. So some of the students in Japan, they didn't have any scholarship, so they have to work part-time to fulfill their needs and also to pay their to pay their tuition fee. So but unfortunately, some of the shop and some of the restaurant are closed, so they start to lose their part-time job. And other is technical problems. So for example, like you don't have any stable internet connection at home, or like difficult to return to home country because of the travel restriction, which will affect it also on your study and your mental problem, I mean your mental stress. Okay, next. And still have many more, but maybe each individual person will have more problem than this. But in this presentation, I will just show you about this. So I already mentioned about the obstacle, but actually governments support you several things. Especially they give you a special cash handout several times, not only for Japanese residents, but also for foreigners. They give you several times, like this is for like general public. This is for only student support handouts for continuing studies from Japanese Ministry of Education, and then also from the local government to student support plan. And then also if you bring some children in Japan, they can also get the special cash handout. And also all the residences, including the foreigner, will have free vaccination. So I'm talking about the vaccination previously. So I want to show you how about the condition in the vaccination condition in Japan itself. So to get the vaccination in Japan, you firstly will receive the coupon from the government, and then by that coupon, you can get the vaccination in the university or also in the nearby clinics. And then after getting the vaccination, you will get the record of vaccination. In my case, I finished my second dose on August last year. But now over 78% of the total population are fully vaccinated, and the administration of booster shot has been started from December 2021. Okay, I already talked about the support from the government. So what about the university itself? The university also gives some support. For example, they give like food distribution for students who have economical difficulties like this. It's happen periodically. And then also they have student service center for physical and mental health due to COVID related matters. So in this center, they have student counseling services, mental health support, career counseling, and also ability support center. Okay, based on the obstacle itself, I try to make a summary of the tips to survive. Maybe it will be not enough for you, but hopefully it will be useful for you. So first, and the most important thing is to follow the regulation and the prevention guideline from the government and also from the university. And I want to talk more about the prevention guideline from the government in next slides. So second one is to keep your body and mind healthy. So even though you are staying at home, but trying to like move your body and have like a little physical activity and try not to think more about this pandemic situation and like to have a healthy mind is the most important thing. And then third is to try to keep communicate with your family and relative in Indonesia. So even though you are not be able to go to Indonesia and meet them in person, but at least you still have to communicate with them, maybe with video chat or with WhatsApp every day. And then the fourth one is there are several Indonesian community in Japan actually. For example, Persatuan Pelajar Indonesia, we call it PPI, and then Keluarga Muslim Indonesia, we call it KMI. So make sure that you can join this community because even though you are far from your family, you will have new family members in Japan, and it will be helpful also for your mental health. And then try to not lose contact with your friends. So even though you are staying at home, please try to contact your friends as much as possible so you won't feel like isolated in your home. And then don't always stay at home. Try to visit park at night, for example, to avoid the crowds, or try to ride bicycle is good for your health because you will feel like you have like physical activities at least. And then try to communicate every difficulties to your professor and students affairs division in your university. So basically, like professor in Japanese university are very supportive, and anytime you are trying to communicate your difficulty, they try to help you as much as they can. So please try communicate everything. Every difficulties outside of the university is also possible. Then if you are working from home, set your room as comfortable as you can for study, not for sleeping. And make sure you make a schedule for your study. And the last one, if you are feeling unwell, please try to contact the health center in your university as soon as possible. Okay, this is maybe tips to survive from me. I will move to the next slides. So this is the prevention guidelines from the government. So they try to make a new culture in this during this pandemic of COVID-19. So there are 10 important points. So first is that family reunion via video chat, so without visiting hometown. And then second one is go to supermarkets alone in a small group at less crowded time. And then third one is enjoy jogging in a small group in less crowded parts at less crowded times. And then fourth one is do non-urgent shopping online. I think it's getting more convenient to shopping online nowadays. So please try to avoid as much as possible to shopping offline. And then the fifth one is enjoy with friends online. For example, you can eat together with your friend with video chat. And then six is to use remote medical services. So some of the medical services in Japan has been provided some like online service, so we can try to utilize them. And then 7.1 is to use videos at home for workouts, for example, or for yoga, for example. And then number 8 is use takeout or delivery for food. Maybe in Indonesia, you can utilize GoFood, Gojek, I mean like GrabFood and other things. And then number 9, work from home. And then 10 is wear a mask when talking. So the important is to avoid the 3C. The first C is to avoid the closed spaces with poor ventilation. And the second C is to avoid crowded places with many people. And then the third C is to avoid the close contact setting involving close range conversation. And of course, washing hand, coughing etiquette, airing, and health monitoring are very important. In Japan, we also have an application named Cocoa. It's COVID-19 contact confirming application. So this application will directly notify you if you are going outside and meet with some COVID-19 patients. So it will be useful for the government to easily tracing the close contact persons. So follow the regulation and guidelines from the government is necessarily important. So this is my last slide. Thank you for listening my presentation and thank you for your attention. So if you have any question outside of this webinar, please feel free to contact me if anytime in this email address. Thank you so much. And I will give it back to Mr. Anton Saputra as moderator.
Okay, thank you, Miss Sari. Sorry, I quite wrong to pronounce you as a P3, but you are easy, and then your call sign is Sari. So thank you, Miss Sari. This is such a good presentation, which is, you said that this is quite difficult for international students at with current situations, financial problem and also technical problems, program or your school. And then we continue to open question. We'll assist by our interpreter, Ms. Nabila. Please welcome Ms. Nabila.
Okay. First, can my voice be heard? All right. Thank you very much for Dr. Harimat for such an interesting presentation about forming a healthy culture post-pandemic in the community, and as well as Ms. Fitri Kurniasari for delivering the presentation about living as a student during COVID-19 pandemic in Japan. All right. Now we are going to read about the question. There is a question from Miss Siti Fatimah Atiyah. The question is, the largest population in Indonesia applies to what kind of health behavior habits during the COVID pandemic? How to educate close family members to implement a health behavior system, because in fact, educating their own family is more difficult than educating others. That's the question for Dr. Harimat. I will give the time for Dr. Harimat to answer. The time is.
Okay, thank you, Bu Nabila. Thank you very much, Bu Fatima. From the 3 health behavior that we already discussed before, the first is the keep distance, and the second is hand washing, and also the third is wearing mask. The task force data give a clue that for the hand washing, 80% people often or always wash their hand with soap for 20 seconds, and 80% also people often or always wearing a mask when outside the home. I think it is the same proportion for the 2 behavior. And for the second question, I think it is depend. Not always educating the family is more difficult than others. I think it depends on how respectful the head of the family in the eyes of his children or in the eyes of his family, and also depend on the commitment of the head of the family and the awareness and also understanding of the family, as well as health literacy in it, and also depend on the education level of the family. I think that is Bu Nabila.
All right, thank you very much for the answer, Mr. Harimat. Now we are going to the second question. The second question is from Ismail Soleh. The question is for Ms. Fitri. Okay, sorry. The question is for Ms. Fitri. The question is how many cases are now in Japan as in for the corona pandemic, and then what is given by the hospital or health facility in Japan to patients with corona itself. Also, one more thing from Mr. Ismail. What did the Japanese government implement there that we need to emulate as Indonesian citizens? That's all the question from Mr. Ismail.
Okay, thank you, Nabila. Hey, thank you, Nabila, for the question, and Mr. Ismail. So for now, the cases in Japan is detected about 85,000 per day. So it's the highest number of cases as we can see for these 2 years. And half of the 85,000 cases is needed a hospitalization. So unfortunately, it's very tough for now. So second question is like, it depends on the symptom itself. So if they have only like symptoms, then they can stay at home. But if they have a high symptoms such as difficulty to breathe, then the hospital will give you the medication based on your symptoms. And then what is the Japanese regulation to follow? So I guess the Japanese government regulation is almost similar to Indonesian government regulation, such as the the state of emergency is almost similar to the PPKM, for example. But I think the most important thing is the changing of the behavior of the citizens itself, rather than the regulation from the government. So even though the government give very good regulation, but if the people do not follow of the regulation itself, then it means nothing, I guess. So this is my answer. Thank you. I will give it back to you.
Thank you, Mrs.
Thank you, Ms. Fitri, for the answer for Mr. Ismail's question. Now we are going to take the conclusion from the presentation that has been presented by Dr. Harimat and Ms. Fitri. As we have seen about the presentation from Dr. Harimat about the healthy measurement is really important as to curb this crucial pandemic that has run almost 3 years. It may hinder everyday's activities, but with safety measurements put in place, safe distancing, mask wearing, it will still be possible to do everyday's activities. And as well as Ms. Fitri, about the presentation, we can take examples from steps and protocols Japan has in out for their residents, from immediate state of emergency, aftermath of every wave of pandemic, like how they support its citizen, prevention guidelines here are also another example we can take note of. Okay, maybe that's the conclusion we can take from the presentation. I will give back the time to Mr. Siswa Anton.
Bu Nabila,
Yes.
excuse me. We have a question from Evita Rahman. We still have time?
Thank you, Ms. Nabila, for assisting us during discussion session.
All right. Okay, maybe there is one more question from Miss Evita Rahman for Dr. Harimat. From the data shows that Kalimantan has the highest and obedient culture. Please, would you like to explain about the indicators contained from the research?
Okay, firstly, thank you, Bu Nabila. Bu Evita, I think I should make it clear first that the data is not talk about the inobedience of the Kalimantan or the other province. The data is talk about the perception, risk perception. So from my presentation, on average, only 3 until 5% of the population in the province is not worried about the coronavirus. But 15 to 30% of the public feels not at risk of contracting it. I think the South Kalimantan is the lowest in the risk perception in that survey, the result of the survey. So I'm more worried about the Jakarta people and the East Java. Thank you, Bu Nabila.
Thank you very much for the answer, Ms. Dr. Harimat. And then overall, we can never point out or agree to a good system until we follow. It's for the greater good for everyone. There are always alternatives to solve the impossible. Okay, I will give back the time to the moderator, Mr. Siswanton. Time is yours.
Okay, thank you, Ms. Nabila, for assisting us during discussion session. All right, ladies and gentlemen, this discussion is very interesting. However, unfortunately, we limited by time. Hopefully, all presentation from presenter has been delivered by our two speakers can add insight, so that for we end this session as a presentation to our great speaker, we will give certificate to Mr. Harimat. For the committee, please show the certificate. Thank you for Dr. Harimat for your presentation, and also thank you for Ms. Sari for your presentations. And then we will continue to take a picture as a documentation for us. We'll assist by Ms. Valen. Ms. Valen, are you ready?
Ready. Okay, ladies and gentlemen, we will take documentation. Please turn on your camera. Ready? 1, 2, 3. Second page. 1, 2, 3. Okay, finish. Thank you.
Okay, thank you, Ms. Palen, for assisting us to take a documentation. Okay, ladies and gentlemen, I close the second panel session. Thank you for your attention, and please apologize for all mistake. Please stay healthy. MC, Ms. Ratna, please take the time, and thank you.
Thank you to Ms. Rima Ida and Mr. Siswa Anton Saputra who have guided the discussion, and also thank you to the speakers who gave presentation on the extraordinary material today. Lots of information, explanation that increase our knowledge so that we hope we can apply it in our daily activities every day as a public servant, health servants, and we are still enthusiastic about living our lives during this pandemic and after it. And may we always be in the protection of God Almighty. Amen. Okay, the next agenda. The committee will share the evaluation and the attendance link to get an e-certificate. To all participants, please fill in, write the full name with the title. We gave you 10 minutes to fill in. While waiting, we will show a video of the history of change of Sekolah Tinggi Ilmu Kesehatan Indonesia Maju and Sekolah Tinggi Ilmu Komunikasi Indonesia Maju, STIKIM and STIKOM IMA into University of Indonesia Maju. Okay, once again, to all participants, please fill in the attendance link to get a certificate. And then we will display logos or videos of the sponsor. This event is sponsored by PT Arjuna Perkasa Medica, which is engaged in medical needs, consumable, reagents, calibration, and medical supplies. And CV Success Minor, which is engaged in services, development, renting, and transformation and transportation. Okay, ladies and gentlemen, I will announce the 3 best questioner who will get prizes in the form of the first winner is Ismail Soleh AMD SKM. The second winner is Atmi Mufliha. And the third winner is Siti Fatima. Congratulations to the 3 participants. The committee will contact the winner. The prize is brought to you by the sponsor. Okay, ladies and gentlemen, next, closing speech from Vice Chancellor for Non-Academic Fields, University of Indonesia Maju. Dear Dr. Rindu SKM MKes, the stage is yours.
Okay, hello, Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen. I want to thank the speaker, the honorable keynote speaker, that we have been listening from Prof. Melly from UI, explain about importance of boosting immunity, ya, dimana kita nggak perlu khawatir, tapi tetap waspada dan kita harus meningkatkan imunitas dalam tubuh kita sendiri. Dan Prof. Rampal from University of Cyberjaya Malaysia explain about post-pandemic, especially in Malaysia. And Dr. Harima explain about post-pandemic situation in Indonesia. And Mrs. Fitri Kurniasari, ya, candidate of doctoral from Nagoya, Japan, explain about if you want to study in Japan, semoga bisa menjadi motivasi untuk teman-teman semua untuk studi lanjut di luar negeri, ke Jepang mungkin, ya. I think this is a great international webinar. The speaker are from 4 institutions and from 3 countries, Indonesia, Japan, and Malaysia. The honorable invited guests and all participants, our beloved chairman and founder of Yayasan Indonesia Maju, Mr. Dr. Andes Yaakob Hatip, and Professor Hafizur Rahman, and also temporary PIC of our rector, University of Indonesia Maju, Ibu Dr. Astrid Novita, and most importantly, the honorable organizing committee of International Webinar of IMA, Department of Public Health, especially our lecturer in public health, Mrs. Nina and Mrs. Istiana, and my lovely students. Hello, my student from Indonesia, from Japan. Ya, teman-teman harus tahu bahwa kita punya teman-teman yang di Jepang yang juga kuliah di UIMA, ya. And maybe they are student from University of Cyberjaya Malaysia. Hello, maybe nice to meet you. We know that COVID-19 is not over, but we have to keep moving and stay productive and stay healthy. Also, yeah, I hope that this international webinar will be one of our triggers to keep our spirit, stay healthy, and be useful for the family and the community. Yeah, and hopefully international seminars can be held every year untuk semua program studi di UIMA ya, dan tentunya also attended by many participants from abroad ya, dari luar negeri, jadi bukan hanya dari dalam negeri saja. And give applause for the public health study program, and especially for our lovely campus University of Indonesia Maju. Bangga nggak kalian ya menjadi bagian terwujudnya UIMA ini ya. You all also so awesome ya. Thank you ya for being a part ya, jadi realisasinya UIMA kita. Okay, I close this webinar. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam. Waalaikumsalam warahmatullahi wabarakatuh.
Thank you to Ms. Dr. Rindu SKMMK. Okay, the next is the moment we have been waiting for, the announcement of the result of the 2 best questionnaire and the highest score for the post-test. And the winner is Rizky Kusuma Hartono and Fani Hanifah. The committee will contact the winning participant. Please give big applause. Thank God our event is over, and I'm convey information to the participant of the webinar. With the end of today's webinar, we all committee members of the Public Health Study Program would like to thank the invited guests, research person, and viewers, as well as all participants for their participation in today's webinar. And we apologize if there are many shortcomings in the conduct of webinars today. I close this event and thank you. See you at the next webinar event. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Waalaikumsalam warahmatullahi wabarakatuh.
Selamat ya Pak Santon, Pak Siswa Rindu. Selamat buat teman-teman.
Terima kasih Pak Harimat.
Terima kasih Pak Harimat.
Merupakan jantungnya
sembuh ya, Pak.
Masa sakit terus Bu.
Sehat terus ya Pak.
Terus Pak Harimat.
Di Jalan Harapan nomor 50, Lenteng Agung, Jakarta Selatan, didirikan atas dasar rasa cinta tanah air dan ingin berkontribusi dalam mencerdaskan kehidupan bangsa melalui bidang pendidikan. Stikers Indonesia Maju berkomitmen dalam mencetak lulusan yang siap bersaing dan menjadi tenaga kesehatan yang profesional di bidang kesehatan. Sesuai dengan visinya, Stikers Indonesia Maju menjadi institusi yang berdaya saing nasional dalam pengembangan ilmu pengetahuan dan teknologi di bidang kesehatan melalui pengembangan masyarakat untuk meningkatkan derajat kesehatan. Stikers Indonesia Maju saat ini sudah terakreditasi oleh Bank PT dengan predikat B dan memiliki 13 program studi, diantaranya S2 Kesehatan Masyarakat, S1 Kesehatan Masyarakat, S1 Ilmu Keperawatan, Program Profesi Nurse, Sarjana Terapan Kebidanan, Pendidikan Profesi Bidan, S1 Administrasi Rumah Sakit, S1 Gizi, S1 Farmasi, Sarjana Terapan Keselamatan dan Kesehatan Kerja, Sarjana Terapan Manajemen Informasi Kesehatan, Diploma 3 Administrasi Rumah Sakit, dan Diploma 3 Asuransi Kesehatan. 7 di antara program studi sudah terakreditasi B.
Assalamualaikum warahmatullahi wabarakatuh. Selamat datang di STIKIM, Sekolah Tinggi Ilmu Kesehatan Indonesia Maju. Saya, Asri Tovita, sebagai Ketua Sekolah Tinggi Ilmu Kesehatan Indonesia Maju, ingin memperkenalkan STIKIM sebagai kampus pendidikan kesehatan yang telah berdiri sejak tahun 2000. Sampai saat ini, STIKIM telah meluluskan sebanyak 9.345 lulusan. STIKIM telah memiliki 13 program studi, yaitu Magister Kesehatan Masyarakat, Sarjana kesehatan masyarakat, sarjana keperawatan, profesi nurse, kebidanan program sarjana terapan, pendidikan profesi bidan program profesi, sarjana gizi, sarjana administrasi rumah sakit, sarjana farmasi, sarjana terapan manajemen informasi kesehatan, sarjana terapan K3, diploma 3 asuransi kesehatan, dan diploma 3 administrasi rumah sakit. STIKIM telah terakreditasi dengan predikat sangat baik. STIKIM memiliki visi pada tahun 2038 STIKIM menjadi institusi yang berdaya saing nasional dalam pengembangan ilmu pengetahuan dan teknologi di bidang kesehatan melalui pengembangan masyarakat untuk meningkatkan derajat kesehatan. STIKIM sedang berproses menjadi Universitas Indonesia Maju dengan konsep Health Tech berbasis komunitas. Besar harapan kami, STIKIM dapat terus berkembang menjadi kampus pendidikan kesehatan terdepan sesuai dengan moto kami, The Heart of Health School. Semoga STIKIM selalu memberikan manfaat dan dapat mencetak generasi untuk memajukan kesehatan Indonesia. STIKIM untuk Indonesia Maju. Assalamualaikum warahmatullahi wabarakatuh.
Dalam proses belajar mengajar di Stikes Indonesia Maju, selain tatap muka, terdiri dari praktik laboratorium, praktik klinik, dan tutorial. Didukung dengan tenaga pengajar yang profesional di bidang keahliannya masing-masing, serta sudah berkualifikasi akademik S2 maupun S3. Tidak hanya itu, Stikes Indonesia Maju memberikan beasiswa kepada mahasiswa berprestasi dan kurang mampu. Stikes Indonesia Maju memiliki fasilitas untuk menunjang proses belajar mengajar seperti internet hotspot, perpustakaan yang lengkap dan update, laboratorium terintegrasi, laboratorium bahasa, laboratorium komputer, laboratorium audio visual, radio komunitas untuk menunjang promosi kesehatan oleh mahasiswa, serta sistem informasi akademik mahasiswa yang berbasis teknologi informasi. Stikes Indonesia Maju juga telah memiliki rumah sakit sendiri, yaitu Rumah Sakit Dr. Hafiz di Cianjur, Jawa Barat, sebagai sarana untuk menunjang mahasiswa dalam melaksanakan praktik di lapangan.